And what we did was we highlighted a few issues related to healthcare system. So these were issues related to health infrastructure, basic availability of health services, issues like out of pocket expenditure, how the insurance coverage is not adequate. Then we started looking into various measures that the government has taken. And we had classified all these measures into health management related measures. And then we had been discussing preventive measures. And after these preventive measures, what we'll do is we'll take care of curative measures as well. What we have to do is that all the issues and all the suggestions that we are taking up, think in the direction of objectives of your health policy. And we said objective of the health policy is to provide quality healthcare, access to quality healthcare, and affordable healthcare. That is what the idea was. And to see that we have been targeting universal health coverage through various factors. Now remember this, if a question is asked from here, what they can do is they can take up a specific dimension and they'll ask how would it help in achieving universal health coverage, right? How would it help us to provide access to quality and affordable healthcare to people? And we are going to look into similar question uh, based on the same thing. So yes, we had given a homework on sustainable development goals, that how, if we talk about nutrition, how can nutrition help us achieve various sustainable development goals? And you had to look into what are those various sustainable development goals which can be achieved through providing nutrition, through achieving zero hunger in our country. So did everyone go through the sustainable development goals? Okay, so a couple of you have gone through the sustainable development goals. What about others? See, sustainable development goals are something that finally the entire uh, say world has a consensus on, right? Do you find a consensus on other things? Do you find a consensus or international consensus on other things? And the answer is not really, right? But sustainable development goals are something that we find. Okay, great. So a few of you are writing. So Vaishnav suggested that there is Sustainable Development Goal 3, which talks about health and well-being. So if you provide adequate nutrition, if we reach zero hunger, then we can definitely take care of health and well-being. That you are talking about great clean water and sanitation, reduced inequalities. Okay, is Vaishnav the only person who has actually gone through the Sustainable Development Goals? Okay, for the ones who are actually not taking it seriously, I'll just show you something. Here. So look at this question related to education. Right, education is something that we'll cover later, but you just look at it. They've already asked a question that how National Education Policy 2020 is in conformity with the Sustainable Development Goal 4. It intends to restructure and reorient education system in India, and we had to critically examine this statement. Now just think about it. If you were to answer this question, if you look at this question in your examination, you'll find that this is a bouncer. You'll think it is a bouncer and you would not know how to approach this, because a few of you might not even know what these sustainable development goals are. Forget about sustainable development goal 4. So one idea is, please keep going through the sustainable development goal list. Ultimately, they can ask a question in prelims as well, right? So you have to prepare for prelims. And the question that we had framed yesterday was basically about how, if we take care of nutrition, how, if we achieve targets under Sustainable Development Goal 2, how would it affect various other sustainable development goals? So similar question can be framed on health. A similar question can be framed on education, right? Okay, so a few of you have suggested, great, Sustainable Development Goal 3, 6, 8, and 15. Okay. Okay, so just look at this. This is the question that we had given. Achieving household food and nutrition security in India is crucial for meeting sustainable development goals. Now, we have not mentioned particular sustainable development goal. In the question that they have asked in the past, we're talking about Sustainable Development Goal 4, which is basically based on education. So it was an all-encompassing question, and here is the list in front of you. Here is the list in front of you. So remember that when we talk about poverty, we were saying if a person is not healthy, if a person is malnourished, ultimately they'll end up below the poverty line, or they'll end up in the vicious cycle of poverty. Sustainable Development Goal talks about no poverty. Similarly, zero hunger is directly related to nutrition security. Think of good health and well-being. A few of these have been suggested, right? And also, these are a few sustainable development goals which are directly in consonance with providing nutrition. There can be others as well. So if you talk about equitable, providing access to providing access to resources equitably, then you think of sustainable agriculture. All those things can be, right? All those things can be included here. So just do one thing. You have the answer here, but it is not about this particular question. I'd ask this question so that you try thinking for yourself, because this is something that is related to a previous year question. So previous year questions are something from where you have to take a cue. It is not just about, say, learning what is malnutrition. Ultimately, if you're not able to answer the questions, the entire purpose of taking these long, boring classes is defeated, right? So it is better to put in a little effort. So you can just think of these and other sustainable development goals as well, right? So I don't think this is a question where you would have to, say, suffer a lot. You can easily think about various sustainable development goals, what can be the introduction and the conclusion as well. Okay, coming back to our discussion, and we had left our discussion at digitization of healthcare. Okay, here we are. Yes. So we were talking about various preventive and curative measures that government has taken, and we have already discussed your health management system. And again, I'm saying this again, that when you look at a question, when you look at all these measures, think of how that measure would help us achieve universal health coverage. That is what the point is, right? So they can ask a particular dimension, and I have provided the solution for that as well, so that you are very well equipped if any kind of question is asked. Okay, so think of digitization. The first idea is, how can it address the problems that we have? We have problem related to equity, we have problem related to access, we have problem related to affordability. How can digitization take care of these issues? Why do we need digitization? So if you think about it, with digitization, there are people living in remote areas. With digitization and with the uh, Digit Doctor, that is one program under your digital mission, you'll find that people living in remote areas now can access quality healthcare, can access better healthcare sitting at their place using digitization. So it can make your healthcare services effective, it can enhance access, it can make it cheaper. Also, if you think of how can we just think of the ways in which you can digitize your healthcare system. You can digitize all the records. If you go to the bigger hospitals now, they now create a digital profile for you. If you happen to go to a say private hospital, and even your good public hospitals like your AIIMS, you find that they'll create a profile, a digital profile for you. All the data will be stored there. So which makes the process effective, which makes the process lacuna free. Then providing healthcare facilities in remote areas, etc. Now you can order medicines online. You can take a prescription from a doctor online. Think of mental health, how it can help us with mental health. So people, and we see that when it comes to mental health, people are not aware. There is say hesitation if one has to go to a mental health practitioner. Now they can get those services online sitting at their home. They can get in touch with a counseling psychologist or clinical psychologist and get the problem solved sitting at their home. And when we are say providing these services through digital means, it becomes a lot cheaper, right? Because you do not have to say think about the consumer or the one who has to get the service, medical services. They would not have to travel all the way to other areas. They can get these services sitting at home. Similarly, to provide these services, now the doctors or the healthcare system does not need a lot of infrastructure, physical infrastructure. So there can be various problems which will be effectively addressed by digitization. Now, if you want to think in the language of the government, you'll find that all the aspects related to your national digital health mission that I'm sure that everyone would have heard of, you'll find various benefits of national digital health mission, and it will give you a complete answer. So if you think about a question wherein they ask what can be the problems or what can be the significance of digitization and what can be the associated challenges, you can get all those things in one place from your national digital health mission. Now, if you think of national digital health mission, there are various programs under it. You can think of Health ID, wherein they create a ID or digital ID wherein all your information, all the information of a patient is stored. What kind of prescriptions are you on right now? What kind of medicines you have been taking? Where did you go for your last checkup, etc. So all your health related records can be found in one place through an app. It can be accessed through an app. Then you think of digitizing all your records related to your birth certificates, related to death certificates. Now, if you see, if anyone has happened to get your birth certificate, right, for maybe purpose of getting a passport, etc., you find that now you can just apply online and get it online. So they have been digitizing all those records as well. Similarly, there can be a record of a person of a person uh, within a particular institution. So if you say go to a private hospital or a public hospital, all the prescriptions or whatever say suggestions you have taken from the doctor, when did you come for the checkup, what were your last reports, because you generally have to take up various tests in the medical facilities. So all those records can be found in one place. Similarly, along with this, you'll find the idea of DigiDoctor, wherein sitting in remote areas, you can get access to doctors who are there in urban areas, better doctors. Now, you have all these things right in front of you, that what is there when it comes to National Digital Health Mission. Now, think of the problems. Can you think of various problems related to this digitization of your various records, etc.? So Gayu is asking whether we have to make notes. Is it important? See, even if you do not make notes right now in the class, it is better you make notes during revision. It is better you make notes during revision so that you have everything in one place. Right? It'll be easier for you to revise. And also, if you remember the idea of notes, we're saying that we'll go on integrating things from current affairs in your notes itself, because otherwise, whatever keeps coming in the newspaper, you would not remember during the examination. So if you have some report coming up, it is better you extract that data from there, all those points from there, and keep them in your notes itself. Okay, so you're saying that it can become an issue of data privacy. So your data can be leaked. It can be accessed by someone that you would not want to. Then unavailability of infrastructure, that to access any kind of digital services, you'll need digital infrastructure in place. So at the same time, we are saying that it will be cost effective, but you see that it'll increase the initial cost because the healthcare establishments would have to digitize everything. They would have to lay down that infrastructure. And also think about whether all the people, because it is very convenient to say that now people sitting in remote areas can access everything on their mobile phones, etc. But do they actually have the skills, or do they actually have the infrastructure to access those services online? And the answer is again no. So there are huge gaps which have to be filled. Similarly, yes, so the idea of digital divide, people do not have the if you think of people coming from rural areas and socioeconomic socioeconomically backward sections, you'll find they do not have any awareness when it comes to using digital means. Think of the skill set that would have to be developed, or the capacity building process that would have to be done for your healthcare practitioners, for all the staff members related to any healthcare facility. So these can be various challenges related to digitization of healthcare, and particularly these are the challenges associated with national digital health mission. Now, for a few of these issues, we already have an answer. So think of the idea of consent manager and gateway. So as long as you do not give consent to someone, they would not be able to access your records. So the problem related to data privacy can be solved. Similarly, now they are working on capacity building measures. So they have the wellness centers even in rural areas. Now those wellness centers will have those facilities. All the staff members will be trained, and they are already undergoing that training. But you still find there are a lot of problems that keep arising. You find that when it comes to the directory of birth records, you find that close to 15-20% of the birth records were not digitized. Think about those people. And because it actually happened for the people who were born in the early 90s, most of the people from that timeline. So a few of my you might have actually faced the problem. So these can be various issues and challenges related to National Digital Health Mission. And everything is mentioned here. You can just simply go through it because you understand digitization fairly well. Because this is digitization when it comes to healthcare. Then again, we are going to talk about digitization when it comes to education as well. Because it will actually fast track a lot of processes. Right? Because now, if you have to think of any kind of services that you are getting, now think of this service you are getting right now. Without digital means, it would not have been possible because it has made it affordable and convenient for you. Similarly, think of the prescriptions you can get. Think of any counseling facility you can get online related to healthcare. Think of the medicines that we order online these days. Yes, there can be problems which have been mentioned as challenges here. Along with the benefits that we have already looked into, you have the challenges mentioned here as well. Whatever challenges that you have highlighted have been, you'll find them mentioned here. So please understand that they might not ask a direct question on how what are the challenges related to National Digital Health Mission, etc., because this will be a fairly easy question. So they might ask a question relating digitization to universal health coverage. They might not write it out there. They might not keep it as simple, but the answer will actually come from here, because they might ask that how can digitization of healthcare help us achieve universal health coverage, or how digitization of healthcare is in lines with or is in consonance with the principles of your national health policy, right? So they can make it slightly difficult for you. So but be prepared that whatever content you have here, the only thing you have to do is you just have to understand the question better and reproduce what is provided here. Digital divide is just compare a person or say of the age group of 60s, that too from rural areas, and compare yourself with them. So you are digitally say aware, you are digitally literate, you know how to access various services, you're getting used to these online classes, etc. But think of those people, think of your grandparents. Would it be as simple for them to understand what goes on around on a smartphone? Then also you'll find differences of in people coming from rural and urban areas, differences based on age group, differences based on gender, right? So this is what digital divide is. Uh, what you mean by digital divide? Now, if you remember that we were saying with privatization can help us improve access. Privatization can help us improve quality of healthcare services. But one problem that we found associated with privatization of healthcare was that it is not affordable. It leads to a rise in expenditure to get those healthcare services. So related to that is the idea of out-of-pocket expenditure. And what we had mentioned was that we are saying that insurance, providing medical insurance to people can be one solution. Providing medical insurance to people can be one solution. Now, apart from medical insurance, to limit the cost or to curtail the cost or to keep a check on the out-of-pocket expenditure, can you think of other ways? Can you think of other ways to reduce this out-of-pocket expenditure apart from providing medical insurance? Okay, so a push towards generic medicines, the idea of compulsory licensing that we will come to. Making the government facilities better, absolutely yes. Okay, so you can think of various government measures in this regard to reduce the cost. There has been a definite push towards generic medicines, compulsory licensing, etc. Right. So there can be various ways that we will come to curtail or to reduce this out-of-pocket expenditure. But the first idea is, what exactly is this out-of-pocket expenditure? Now, this expenditure is actually the expenditure you make at the point of receiving healthcare services. For instance, you go to a hospital, the first thing that you have to do is you have to get an appointment and you have to pay some money, 200, 500, 1000, 1500, on the basis that actually depends on the hospital that you are visiting. So the first thing is you have to pay for consultation charges, okay, to get an appointment. Post that, you go visit the doctor. They say that, okay, please get these tests done. For example, get your blood pressure checked, get your blood test done, and come back with those reports. Now you go to a lab, or maybe there's a lab within the hospital. You go get those tests done, and you have to pay them again. Now, after going through those reports, the doctor would prescribe a few medicines. The doctor can say suggest an operation or any other way, right? Any other medical treatment, and you would have to pay for those services as well. So this is basically your out of pocket expenditure. Now if you remember that we had looked at a little data compare which talked about the out of pocket expenditure, and you see that yes, there has been a decline in out of pocket expenditure from 2015 to 2020, but it is still very high. It is still very high. And out of pocket expenditure is one of the major reasons behind poverty as well. Because this is something that can easily push any family, any household below the poverty line. You think of the amount that you have to spend. And to bring this down, to bring this out of pocket expenditure down, one idea is that of your health insurance. And think of the government measure, think of the Jan Arogya Yojana, wherein the government is providing insurance to the weaker sections. Apart from this, One idea is, if we look at the private hospitals, that is where maximum out of pocket expenditure happens, because ultimately these are private healthcare services which charge a lot. So why not regulate the private sector first? Why not keep a cap or ceiling on the prices, on the amount that they can charge for a particular service? If you remember this was something that happened during your COVID pandemic, that ultimately government had to intervene and put a cap or put a ceiling on the amount that they can charge you for the COVID treatment. So one idea is that. Second idea is provide medical insurance, so that the user or the one who's getting the service, the patient and their family, they do not have to worry about any kind of out of pocket expenditure. It'll be covered through medical insurance. Also, when you think of out of pocket expenditure, you'll find that most of the out of pocket expenditure comes from medicines, that you have to spend a lot on medicines for that matter, because it is not always that they will prescribe a treatment for any illness. The first step is that, let's see, if the medicines do not work for a week, then we might have to go for something else. So if you reduce the price of medicines by pushing generic medicines, providing compulsory licenses, etc., you can actually uh, make a dent on this out of pocket expenditure. And for reducing the prices of the medicines, you already have these government shops within your Ayushman Bharat program. That yes, you can definitely put a bar on, or keep a bar on diagnostic test, how much they can charge for diagnostic test, etc. The definition for out of pocket expenditure has been given here. You can just go through it. No need to say remember everything. It is okay. It is you'll find it mentioned here, right? You can just go through it. It is a fairly simple idea, and you have the definition here. So do not worry about the definition. No one's going to ask you about the definition. And we have seen, looking at the previous year questions, most of the questions that you find, particularly in paper 1 and 2, you find that there is no need for definition at all, unless until it is something complicated, right? Nevertheless, the definition is here. You can just go through this write-up later during revision. Right now, just try to understand more and more. So the other idea to keep a check on this out-of-pocket expenditure is health insurance, providing health insurance. And if you remember from the Niti Aayog report we were quoting yesterday, the 30% of the people are actually not covered under any kind of insurance. And even if I ask you guys here that how many of you are covered under any kind of medical insurance, most of you would say, no, we are not. So this 30% is a very conservative estimate, but nonetheless, you find that this 30% actually comprises of your weaker sections. It is mostly people from poor socioeconomic background that you find are not covered under any kind of insurance. That is what the report highlights. Yes, so recently, yes, there has been a definite push towards generic medicines, because see, there's no issue related to quality. It is same. They have followed the same process. The only thing is that people have the mindset, and generally, if you look at your private hospitals, it is because of the unholy nexus between the doctors and these pharmaceutical firms that they end up prescribing the same medicines. The pharmaceutical company would say that, okay, I will give you commission. Please go on prescribing this medicine. So there is no harm in taking those medicines, but the cost of those medicines is higher compared to your generic medicines, right? And we will come to that part, because it is there mentioned there in compulsory licensing. That is one of the other measures to reduce the cost of medicine. So again, the basic idea is, why did I bring in medicines here? So that you do not look at everything in watertight compartments. You see, you have to remember that everything is connected, everything is related. Okay, so Sneha, your question will be answered. When it comes to Ayush, your question will be answered, and your question will be answered through a question towards the end of the discussion. Now, if you see, that when we were looking at management system, we were talking about various issues related to your health infrastructure, right, and related to human resources, etc. Now there is this other idea of governance and accountability. Now for this, right now you can just think about what can be the problems in execution, what are the general problems that you face during any kind of services, right? If you go to get any kind of services, what are the problems that you face? But to get a definite answer for this, we have to wait till our last lecture, to uh, get a comprehensive idea about what is it that the government can do to fix these accountability and governance related issues. And again, we have, as already highlighted, we also have a question based on this idea, that what can be the various problems related to execute or implementation of our national health policy, and all these ideas will be pretty much covered there. So please do not worry about this part, it will be covered. And overall, you would have understood that yes, there is a lot of corruption when it comes to service delivery, right? The doctors are not present, the doctors take up services of other or take up jobs in other private hospitals and do not go for their public practice. And this is something which is very common in rural areas, that you would not find the doctors and other medical staff there. They either open up their own private clinics and ask the people to go visit them there in their private clinic. And even at times, you find that it has happened out of personal experience. The doctor was suggesting that it is better you come to the other hospital that I work in, because we provide better services there. So here it is just for namesake, right? So your problems would not be solved here. It is better you come to the private hospital that I work for. So this is something of a problem. And again, when it comes to the implementation of various schemes, rather than keeping in mind the specific requirements, the specific needs of those areas, the central government imposes all those schemes and programs. And this again is a usual problem. Then it comes about how various state governments would not respond to the directions of this center. So if you remember, we were talking about the implementation of health and wellness centers, that how a few states have been doing poorly when it comes to implementing this program of health and wellness centers. Now with this, we are we are going to think about various preventive measures that can be taken by government to prevent any health related problem. Okay, let me look at a few questions first. Okay, yes, Fabina. So, Fabina is saying that when it comes to insurance schemes, it is because of the high premium and also because of awareness levels in people that you find people do not go for health insurance. And this has been mentioned here and highlighted by the Niti Aayog report, that you find because if you look at the data, it says that most of the people in this 30% people who do not have any kind of insurance, you'll find them coming from weaker sections. Why? Because the premium itself is not affordable for them. But again, if when it comes to private insurances, when it comes to the role of private sector in insurance, you'd find that there is a limitation. There's a limitation on the extent to which the insurance premium can be brought down. Okay, now just think of various preventive measures. So nutrition and hunger, they have been covered comprehensively. So we're saying that nutrition is one of the basic determinants of health. If you're not getting proper nutrition, if you're malnourished, the chances are you will fall sick very easily. Your system would not be immune. Your body would not be immune to a lot of things. And how to take care of nutrition? I hope you remember from yesterday's discussion that there can be various measures when it comes to malnutrition, right? You can increase awareness. There has to be supply side push. There has to be diversity when it comes to the nutrients that are required. So all those ideas that we had discussed yesterday can be directly mentioned here when it comes to preventive measures and nutrition and hunger. Then you remember that we were talking about maternal health and child health. We are saying that infant mortality rate is high. We have looked at the level of stunting, wasting, etc. in children and how it can be addressed. Then similarly, we were talking about the problem of anemia in women, the problems related to maternal health, women who are pregnant, and also women who are lactating. Because if you think of maternal health, the child health goes hand in hand. Because if the mother is not healthy, if the mother is not taking enough nutrition, it does not get passed on to children as well. So the chances are, if the mother is malnourished, the children will also end up malnourished. And if you remember the numbers for anemia, the numbers for your maternal mortality rate, etc., and the suggestions therein. So you have various schemes, policies, etc., to take care of these issues. Now you think of pollution. Pollution, again, if you remember, your environment, again, being one of the determinants of health. So if the air is polluted, you'll have respiratory problems and you will fall sick. If you have land pollution, fine, ultimately, that is where you get your food from. If you have water pollution, you do not get clean drinking water supply. So all the aspects related to pollution and cleanliness can be thought of together. So when you talk about cleanliness, you talk about clean drinking water and sanitation. So you have various schemes, policies, and I've mentioned that here, and we will go through it briefly. Then you think of pollution, what are the various measures that the government is taking? And also you do remember the exception. You do remember the exception when we're talking about life expectancy. I hope you get this. So if we talk about health, there can be various determinants of health. It can be your environment, right? It can be the healthcare facilities that are available. Then it is your nutrition and lifestyle. So there can be various determinants of health, and we were saying that nutrition and lifestyle are actually the ones which should be given most weightage, right? And then I had given you example of life expectancy. So if we talk about health, there can be various indicators. If you think of health in children, one indicator can be infant mortality rate. If you think of indicator uh, uh, in your female section, think of maternal mortality rate. Similarly, if you want to think of indicators of health in general population, you can think of life expectancy, right? There can be various indicators of health. Now, we were saying when it comes to life expectancy, and I was quoting from the report, that when it comes to life expectancy, you find that one of the major factors determining the life expectancy in people, in population, was the availability of healthcare services. Even though if you look at various other reports, they give more weightage to nutrition and lifestyle. That was somewhere around 50%, then somewhere around 20% to environment, and so on. But you find, if you look at one of the indicators, healthcare facilities, availability of healthcare facilities plays an important role. And therein I'd given you an example of Himalayan states and Delhi. Delhi being polluted, people in general having a worse lifestyle. Why? Because most of the people are either working in the service sector and have more or less sedentary lifestyles. If you think of any rural area, and particularly Himalayan states, you find the terrain is so difficult. So to move from one place to another, you'd have to, say, burn a lot of calories. So ultimately, they have, say, very active lifestyle, and they stick to the traditional diet, which is more nutritious compared to the junk food that we eat in cities. But still, we find that the life expectancy rate in Delhi was better compared to your Himalayan state of Uttarakhand. So why? Again, you remember that anything to happen, there have to be multiple indicators for everything, right? So you do not take an extreme stand when it comes to this, and ultimately breaking these down in dimensions help you with writing your answers. And you have seen that if you want to answer any of the questions, the first thing that you have to understand is what can be the other dimensions to this question or to this statement. So please try breaking it down, because if you think of life expectancy, it is not the only indicator. If you think of environment, or if you think of lifestyle, they are not the only factors or not the only determinants of health, right? When you talk about health of women, if you remember, there was a question about various determinants of health in women, and there were various determinants relating to environment, relating to the socioeconomic structure, relating to the say mental health issues, etc. So there can be multiple factors, multiple determinants of health, and also there are multiple indicators of health. Okay, coming back to the point, think of pollution, how pollution can be addressed. Government has various schemes, various policies when it comes to curbing pollution. Now, next idea, when it comes to preventive measure, now when we think of prevention, we are saying that let's stop the disease from happening. Let's prevent the disease before it happens. So keep your surrounding clean, keep your surroundings clean. Do not let, say, water accumulate in your surroundings during monsoons. The government advisories go on in various states, in every district. Why? Because there'll be, say, a spread of various diseases related to mosquitoes. Similarly, think of vaccination. Get people vaccinated so that they become immune to that particular virus or bacteria. People do not fall sick. Think of vaccination for COVID. Think of vaccination for polio. Think of other vaccinations for hepatitis B, etc. What are these preventive measures? Now, when it comes to vaccination, can anyone suggest a government measure apart from the vaccination for polio, etc.? Can someone suggest a recent government measure to take care of this preventive measure of vaccination? Okay, so yes, COVID, hepatitis B, etc. Right. So you have highlighted the right thing. That is your mission Indradhanush. Now, this Indradhanush mission, Indradhanush, is limited to children and women, right? Apart from your mission Indradhanush, you have other vaccination programs as highlighted. You can take examples from COVID. You can think of any other emerging diseases, right? So yes, vaccination is again important preventive measure that is being taken by government. Apart from mission Indradhanush, apart from the features of mission Indradhanush, just see if there is, because this has become important, and for mains as well, just see if there is any critical analysis of mission Indradhanush that you find in the newspaper, particularly related to its implementation, because the design is super fine. Yes, there can be, we can definitely highlight issues related to the design of this program, but ultimately the design is fine, it is good. Just think of the implementation part. What all are the problems? Because till today we find that when just remember, during COVID, right, a lot of people, particularly from the rural areas, were actually against the idea of vaccination. There are a lot of uh, theories around it, right? That this vaccination will actually lead to impotency. That was one of their favorites. So these theories, etc., these problems keep coming. Why? Because of lack of awareness in general population. And that's why you find that there has been a more push towards making people aware, making people participate in these processes, in these programs. So think of yoga, you think of Ayush, right? They are making people the stakeholders. They are making people responsible for their own good. So similarly, you find apart from vaccination, there have been various programs related to maintaining cleanliness, because if the surroundings are not clean, you are susceptible to diseases. If the surroundings are not clean, you'll find that your body would not be able to absorb nutrition. There can be various problems related to cleanliness, right? To curb that, You remember that you have your Swachh Bharat Abhiyan. You have this uh, drive towards creating new toilets or creating toilets in the households where they do not have any. Then there has been a new drive towards creating public toilets, keeping them clean, etc. Then to keep water clean, you have Jal Jeevan Mission. So all these programs that are there should be mentioned here. Now again, you'll find it difficult to remember all these programs, right? Some of you who might feel that, who have been, say, relatively new to the preparation, they'll feel that, how do I remember all this? Because these, if you think of these measures, there are many measures that keep coming up. But all you have to do is, you have to be patient during the preparation time. And what you have to do is, rather than just taking a list of all the government initiatives and going through it, trying to remember it, it is better you just understand the concept and try to integrate as and when you find it in the current affairs. So you have most of the schemes and measures, government measures, mentioned in the PPT. But yes, you'll find that all these things keep coming in your newspaper. All you have to do is, your concept has to be fine, right? Because the last chapter of poverty was related to hunger. Now this hunger is related to health. Health is also related to education. Education is also related to poverty. Everything is interrelated. So if you remember, in women, we were talking about issues related to poverty, right? We were talking about clean cooking fuel. So that clean cooking fuel, or your Ujjwala Yojana, was found mentioned in poverty. It was one of the factors in your multidimensional poverty index. Then we thought of women empowerment with Ujjwala Yojana. Now you can think of health as well. So respiratory health of women is directly, say, impacted by your unclean cooking fuel. So if you provide them clean cooking fuel, they can get rid of that problem, because ultimately it is women who cook food at home, right? So all these things are interrelated, interconnected, and you have to follow the same approach. Please do not try to mug up all these schemes and facts, because it will be impossible, because ultimately they would not help you perform in the examination. So please try to be a little patient and just keep going through your current affairs, so that you can relate more and more. Because ultimately we are relating everything. We are relating, for example, education to sustainable development goal. We are relating hunger to sustainable development goal. We are relating cleanliness, or your WASH program by WHO, to your sustainable development goals. So yes, so please be aware that you do not have to mug up these facts. Just have to be aware, just need you just need the concept to be strong, so that you can integrate these easily. Okay, example of clean cooking fuel, LPG. Example of unclean cooking fuel, think of firewood, which will give out a lot of smoke. All the moisture that is there, because of the burning of firewood and coal, you see a lot of smoke coming out, which will be directly inhaled by people or the one who's cooking, which is problematic. Now think of the role of education and awareness. If you remember, we were saying that various other indicators of health can be total fertility rate. If you remember, in women, we're talking about total fertility rate. And we were saying that with education, and I think we had framed a question on that, discussed a question on that, that how uh, spreading education and awareness among women, or how women empowerment can actually help control population growth. And there we had given examples. There we had looked at all the dimensions related to fertility, that what are all the factors that impact fertility. Out of those, we picked out a few related to women, right? That was the way in which we approached that question. So think of the role of education and awareness. If people are not educated and aware, they would not know what to eat. They would not be able to maintain a healthy lifestyle. If people are not aware, they would not be able to choose amongst see the types of food. If people are not aware, they will stick to the old superstitious ways. If people are not aware, they will not know. It is not mere fever, but it can be a bigger problem if it persists for a week or so or more. and it is right time to go visit a facility, healthcare facility. So the role of education and awareness has all the dimensions, right? So yes, so Ravi is saying that they'll protest against vaccination. They would not go or take their children for vaccination. So education and awareness also promotes health. It is again a direct indicator or a direct determinant of health. So anything related to education and awareness can be clubbed here. Then also, what you have to do is, when you think of education and awareness, you also think of your research. You also think of research. And this will be covered with education, do not worry, but you also relate research here. Why? Because if we do not give a push towards research, if we do not start investing more on research in healthcare, then ultimately you think about your Ayush, you think about your Ayurveda, yoga, etc. Why are they lagging behind? Why are they not promoted as much as they should have been? Why don't people generally why do people generally go for, say, allopathic treatment rather than Ayurveda, even though we know that there are multiple benefits? Why? Because we do not have a lot of research to support. We do not have a lot of people who are investing in that research. People are not aware about the benefits of Ayush. So all those things have to come from education and awareness. So please try to relate here. So if you remember, yes, so educated women, so these education and awareness, it is not just limited to women. It is not just limited to women. It is about general population, right? Just think of using various contraceptive measures. Is it limited to women? No, it has to be popularized amongst the adults. Then think of the choices of nutrition. Yes, we know that here you find most of you who are sitting here. Yes, you know very well the role of nutrition in maintaining health. You are aware, but the only problem is ignorance. Even though we know that the junk food is not going to help us in the long run, it is not providing our body enough nutrition, but as a matter of self-discipline, it becomes a problem because we go on having junk food. We do not stick to a nutritious diet. We do not just work on say a proper balanced diet, because I believe that most of us who are here at least have the means to get a balanced diet on their plates, but still we don't, right? So yes, education and awareness can help, but ultimately it comes down to the individual, that how they want to actually use that information. Then the idea about mental health, we say that mental health, again, we do not have a lot of institutions who provide mental health care. We do not have a lot of practitioners in mental health. People are not aware. There are various taboos related to mental health. And for this, there was this Mental Healthcare Act, which talks about making it affordable. There should be equality in treatment, free legal services to people, etc. There are various aspects of this Mental Healthcare Act which directly relates to promoting mental health care in a country. And also, when you think of mental health, do not just limit it to mental health. Just also think of Ayush as well. That how yoga and naturopathy can help you with mental health. So when it comes to mental health, there are various factors which impact mental health. You think of mental health and the issues related to transgenders, we find that it is mostly because of the say their interface with the society. The society does not accept their problems. The society does not accept those individuals, because of which they go down this lane of depression and ultimately take to any various kinds of substance abuse. So sorry for the background noise. So I believe we'll persist for another 20 minutes as they've suggested. So let's see if okay. Just suggest one thing. When I speak, does it like subside, or it still remains, this background noise? When I speak, it subsides. Okay, great. Then it is perfect. So it is only me who has to bear, right? That too while talking of mental health. Great. Okay. Okay. Perfect. 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 Okay. So according to your national mental health survey, you find in most of the states in India, less than 1% of the health budget is spent on mental health. If you remember about research, we're saying it is again less than 1%. If you talk about mental health, also it is less than 1%. So we are not giving it due importance, because ultimately your mental health is very important when it comes to your lifestyle choices. Your mental health is a direct contributor to your overall health and well-being, because you would not eat properly if you have any mental health challenges. You would not take care of your physical body, and ultimately it will affect your overall health and well-being. But still we do not find a lot of investment. So one idea is that yes, people have to be made aware about mental health issues, and also the government has to say push the states, various states, that please invest a little more when it comes to mental health. And then also there has to be a promotion when it comes to human resources. So there has to be a promotion, or there has to be an increase in number when it comes to mental health institutions, etc. Okay, so mental health, a direct indicator of suicide. We find that in age group 15 to 29 years, mostly the young, one of the major factors which leads to suicide, which leads to death is suicide. Because in young age, either it can be accidents, it can be drug overdose, and you find that suicide has become one of the most important reasons when it comes to death in this age group. Because yes, in old age there can be various other problems. In young age, again, malnutrition can be a problem. But when it comes to 15 to 29 years of age, when it comes to the young population, it is generally it is said that it is mental health that is actually impacting the lives. Now think of substance abuse. Now substance abuse, you can think of alcoholism, you can think of various drugs that are there prevalent in the market. Not drugs, not the medically prescribed drugs, but uh, your recreative drugs, right? So the ones are that are used for for the sake of entertainment. So if you think of substance abuse, now this substance abuse will directly affect health, that is there. Why? Because if you are taking any kind of intoxicant in your body, it is going to deteriorate overall health. It can lead to various problems, mental health problems, and you find that drug overdose is becoming common, is becoming widely prevalent, because every other day you'd find something or the other related to drug overdose in the newspapers, particularly your regional newspapers. Now the problem is, when it comes to substance abuse, it is not just about stopping substance abuse, it is not just about taking those people to rehabilitation centers, etc. It has to start from the scratch. Now the first thing is that we have to identify why is it that the person has taken to substance abuse, because to understand the consequences of drugs or of substance abuse on health is very simple. Because a few of you might have experienced related to a friend or a family member. The idea is, if you think of taking care of this substance abuse, apart from various other initiatives of drug free India campaign, etc., because that was also there in news recently, you think about the actual issue. Why is it that people are taking to substance abuse? So first thing is that we have to identify that in which age group you find it the most prevalent. For that, we do not have any data. Then also you have to think about various reasons because of which people are taking to substance abuse. Rather than thinking of them as culprits, think of them as victims for once. Think of the people who are into substance abuse as victims for once. Because ultimately, the idea is to penalize. The idea is to penalize someone who is taking drugs, etc. Even our rehabilitation centers work on the idea of punishment. Rather than actually rehabilitating them, they work on the idea of punishment. So the similar way we talk about our, say, criminal justice system, it is more punitive rather than being rehabilitative. So it is more about punishing the individual or punishing the one who has perpetuated any kind of crime, rather than rehabilitating them, rather than uh, changing their mindset. Right? The same thing goes with substance abuse. So the first idea is to identify what is the problem. Why is it that people are taking to substance abuse? So few of you are suggesting that it is because of low levels of literacy. Yes, it can be because of that. If you remember, I had given you example of Afghanistan, that because of widespread poverty, people are taking to substance abuse. Think of the problem of alcoholism in transgenders. Why? Because there is a lot of social stigma, there is a lot of discrimination on the social level, because of which they have to take to substance abuse. Similarly, yes, so ultimately, to get rid of the mental stress, any kind of stress or anxiety, people take to substance abuse. Now, sir, can you suggest any other ideas or any other reasons because of which people can take to substance abuse and sustain this habit? Because I had recently read a report and I will quote from there. Can you think of any other problems because of which people can take to substance abuse apart from social stigma, apart from this? Okay. So poverty, okay, fine. Unemployment. Ultimately, these are more about mental health. Academic pressure, yes, great. Yes. So one idea is, Ravi is suggesting that because of the precedents that are set in our media, because of the widespread use and generalizing substance abuse in your Western media, particularly. So look at various Netflix series, various Hollywood movies. You find that it has been made acceptable, for that matter. So yes, Ambesh has suggested something good, that he or she says that it is because of prohibition of alcoholism in religions that people take to this. And this is, a few of you might find it surprising, but yes, this is one of the reasons. So most of the religions prohibit drinking alcohol. Why? Because they actually generally prohibit intoxication of any kind, but people find their way around, because it is ultimately about our own convenience, right? So religion being a private matter, it is about our own convenience. So you want to get up at 5 and pray, that is entirely up to you. Why not do it in the evening? Okay, which fast do you want to keep? Ultimately, we are the ones who decide the rules, the rituals. So rather than thinking of any kind of intoxication as a problem related to your consciousness, because you would not be conscious, you would not know what kind of acts you are committing. So think of intoxication limited to alcoholism. A few religions limit it only to tobacco use, and do not look at intoxication uh, 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 comprehensively. So they take to other kind of drug abuse. You think of various chemicals that are there. Think of your natural products that are there. So rather than consuming alcohol, they will stick to that. Okay, so because of society and family pressure, etc., etc. So most of these ideas are generally coming from these factors. So apart from this, I was recently going through a report which actually related addiction, any kind of addiction. Now it is not just addiction to these particular substances. It is not talking about initiating the process of substance abuse, but they were primarily talking about addiction, that one can get addicted to a substance because of their genetical makeup. And you'll find this, and you'll find this, that in families, you'll find that there will be a history of alcoholism. So the grandfather, the father, the son, all the family members passing down the generations or going down the generations, everyone is addicted to one or the other substance. So the reasons can be biological as well. Reasons can be something beyond our control as well. So this was a report. Now you just have to remember this idea that it is not only because of various socioeconomic factors that you find substance abuse prevalent. Yes, people might take up substance abuse, or people might get that problem initiated because of socioeconomic factors, but again, your genetics will also decide whether you will remain addicted or not. So this is about your substance abuse, and you see that it has to start from the individual level. It has to start on the individual level. And you find that recently with your Drug Free India campaign, you'll find that they are starting from the ground, from the scratch. They are counting more on public participation rather than push from the government. So they are mobilizing civil societies. They are requesting people from various civil societies to go say inform or make students in schools aware, in colleges aware, right? Because this is the age where one is most vulnerable to taking up any kind of substance abuse or getting addicted to any of the things. So this Drug Free India campaign also has more to do with awareness generation. It is counting on your community uh, participation or public participation. Now they are talking about various treatment facilities, various rehabilitation centers in every region. And again, uh, it has not been explicitly mentioned, but you find that they are now targeting regions which are more vulnerable to drug abuse, substance abuse. So they are now moving more towards your northeastern belt and your northwestern area, northwestern region. The reason being because of the closeness to your golden triangle and golden crescent. You find that these regions are more vulnerable to people taking up substance abuse. Now there can be various consequences of substance abuse that you can go from here, because the women are more vulnerable now. The people, if you think of someone, and if you have watched that movie Urta Punjab, because a few of you might not have watched it because of the language barrier. So you find that if you look at those people who are not getting any kind of drug for a day, or maybe for an hour or two, you find them very irritated. And this is something you'll find in your day-to-day life as well. Just think of someone who is addicted to say consuming alcohol, and you'll find that on your 1st of October they'll be rushing towards the market. They'll be rushing towards the market because they know that tomorrow is a dry day, that is 2nd of October is a dry day, and they would not find any alcohol. And they'll have that mental pressure to say get as much liquor as they want or as they can. Why? Because they need it for the next day. Think of someone who is addicted to smoking. They would not be able to go say for 2 3 4 hours without smoking. So they will remain irritated if they are not given or not provided that the the toxication or the toxicant of their choice. They'll remain irritated. So these can be various problems related to this. Just go through this. This is something that you understand well, because you are in that age group, that you are you basically have exposure to these problems. Yes, see, the idea is, yes, is again talking about various schemes. No, you do not have to mug up all these schemes, but ultimately you'll need these schemes, you'll need these policies and programs of the government to write your answers, because they do ask direct questions. I've shown you questions in the past, and yes, there'll be questions in the future as well. They'll be directed towards a particular program or policy of the government. So what is the way out? Whatever is there in current affairs, try to integrate it. So use the reverse approach. Rather than writing everything in one place and then trying to remember it, use the reverse approach, understand the concept, and if you find anything, any initiative related to it, integrate it. And that is what you find is actually the key to writing better answers, right? If you think of your toppers, if you have gone through any of the videos, if you look at their answers, and I hope you are, because that is going to help you a lot with your answer writing. So if you go through the answers of the people who are actually clearing mains consistently, you'll find they quote a lot from current affairs. They use a lot of programs and policies and examples from current affairs, and that is what enriches their content. That is what gets them extra marks. Okay, so please try to use this reverse approach when it comes to your various programs and policies of the government. Yes, and a lot of schemes would be there in your news that you would have to remember, because they ask questions in prelims as well. But when it comes to mains answer writing, please do not try to mug up these things, because they would not ask you about the provisions of the scheme. Yes, they can ask you about various provisions of the policy, but that'll be again an indirect question. So if you remember that question from education that we will discuss anyways after education is completed, if you look at that question, now that question is indirectly talking about various provisions under our national education policy. And if you look at the national education policy document, it is more than 50-60 pages. Do you have to remember everything? Not really. The only idea is you try to identify the problems related to our education system that we will discuss, and then you think of solutions. What can be the solutions? And if you just doing this exercise, you'll actually be able to cover 70 to 80% of the suggestions that are there mentioned in your national education policy. Okay, so Ghulam is saying that he got 9 out of 15 in one answer. So congratulations for that matter. And okay, this is too high a score, but yes, everyone should try to achieve this, right? Everyone should try to move towards getting better and better marks. Okay, so you can think of your drug-free India campaign when it comes to substance abuse. Okay, now if you remember the problem related to tuberculosis, we were saying, particularly in context of tuberculosis, that now there is a prevalence of multi-drug resistant tuberculosis. What is multi-drug resistance? Basically, think of any kind of illness caused by any bacteria or virus. Now, the doctors prescribe medicines for that, as long you go on taking those medicines. And what happens is, over a period of time, that bacteria gets used to that particular medicine, that particular drug, and then the drug would start would not work anymore, right? If you take that drug, take that medicine, it would not help. Then you would have to switch to another drug. Then what will happen? Over a period of time, continuous use of the drug will again make your body immune to the drug, or make the bacteria or virus immune to the drug, and that drug also will start not working well. It would not have any impact on the virus or the bacteria that is there in your body. And if this happens with multiple drugs, what is it that you can take? Just think of the problem, that initially, if you are taking one medicine, it was helping you curing the illness, but now you have tried multiple drugs, and none of the drug is actually helping you with the illness. What will happen in that case? What can be the solution, right? And that is why we find it to be this multi-drug resistant tuberculosis to be something which is considered equivalent to death today. Your multi-drug resistant tuberculosis is considered to be equivalent to death today, particularly in rural areas. So yes, in urban areas, they are coming up with newer forms of treatment, but ultimately, you find that there is no solution. And now government is also working on this. The government has a national action plan on antimicrobial resistance, so that they can combat this problem with relative ease. because now there can be multiple factors which can lead to this multi-drug resistance. It is not only, say, consumption of those drugs over a long period of time. It is not just fault with that drug, but there can be various other reasons, because this drug resistance can happen even in shorter durations, because it is ultimately, say, you have to think about the variant of that virus or bacteria, for that matter. If you remember COVID, now the COVID virus was continuously evolving over the months, at times weeks. So it was getting used to whatever vaccination was being provided. Those medicines were stopping, were not working. Why? It was mutating. It was becoming stronger and stronger over a period of time. Now, just think about this. If we think of your various Ayush practices, Ayurveda, yoga, naturopathy, Unani, Siddha, homeopathy, Rowa, Sikpa, you'll find that when it comes to these practices, when it comes to traditional medicine in general, you find that they do not have these kind of side effects. Yes, they cannot treat most of the terminal diseases, but at least if these are being used as preventive measures, if these are being used for primary health care, they work well. So there are various Ayurvedic practitioners who do claim that yes, they cannot cure cancer, but at least if it is at initial stages, so say stage 1 or 2, they might be able to reverse it. So if someone is making those claims, the best way to go about it is just conduct a research, right? So look for evidences, etc. Invest in research. Why? Because these can actually be very, say, helpful in curbing these problems. And this is something that has been promoted by the government. And you see, in the recent years, they have been promoting Ayush a lot. The Ayush Ministry has been working really well on this. Why? You find because it actually promotes promotive healthcare and preventive healthcare. Your Ayurveda and all these practices mostly are promotive in nature, are preventive in nature. Because if you go for yoga every day, the chances are that it will help you with your immunity. It'll help you keep your mental health and your physical health in check. Similarly, there are a lot of other practices related to Ayurveda. So Ayurveda basically talks about the various nutrients that you have to find in food. It talks about various kinds of food that you have to avoid, various kinds of food that should be promoted. And ultimately, rather than commenting on the say the on the traditional medicine and these practices, rather than delegitimizing them, it is better to conduct research and find out and figure out for yourself. Why? Because there is a question. I'll show you that how other countries have been using traditional medicine very well. They have integrated traditional medicine in their general healthcare system, and which is actually giving us better results. Take example of China. Even African nations, a few African nations have been integrating this traditional medicine in their general healthcare system. We will come to that. So this is another problem of multi-drug resistance. If you want to cure it, if you want to, the first idea is to prevent it from happening. So how do you prevent it? You can go over traditional medicine. Similarly, when it comes to cure, it is taking a little while, because yes, there are a lot of researches going on in it. There are a lot of researches going on in it, and it might take some time before we actually come up with a permanent solution to this problem of multi-drug resistance. So you can just go through a little data. It has been quoted from various reports, for that matter. Now, remember, we were talking about less than 1% being, say, pushed into research and development. If we do not conduct research, if we do not conduct enough research in healthcare, how are we expecting better outcomes? How are we expecting better healthcare practices? How can we expect better medicines? Which is not possible without research and development. And we'll look at the report by your standing committee on health and family welfare. in 2018, you find they have highlighted various problems. That one idea is that we are not allocating as much to research as we ideally should. Then the idea about not getting enough allocation, there being a mismatch between funds that are allocated and funds that are actually transferred. Then similarly, one side is that the researchers are saying we are not being given the funds that is allocated. And if you remember, not related to healthcare, but otherwise related to education, if you remember, last year or maybe year before that, one of the directors of your prestigious IIM institutions was actually taken in custody. A case was filed against him, and the charges, I believe, were proved that they were not actually transferring the funds that were meant for PhD students. The funds have been allocated, they are getting the funds, but they were not transferring those funds to the students. So similar kind of allegations are there when it comes to research related to health. And now other idea is that the departments say that we are giving those funds, we are allocating those funds, we are transferring those funds, but those funds are not being utilized by your researchers. So what is the point in allocating those funds? So there is a problem from both sides. And also, if you think about health and research, why should it only be a prerogative of your government? Why can't we promote our institutions? Why can't we promote our private institutions and private healthcare centers to actually invest in research? And on this, you'll find that when it comes to pharmaceutical industry, yes, they invest a lot in research and development, because ultimately, if they create a new medicine, if they create a new process to make a drug, ultimately that is where their revenues will come from. So they invest heavily in research and development. And ultimately, the idea of getting it patented is that they should get the return on it. They ultimately want a return on it. But why can't we promote research and development in our institutions, in our higher education institutions? Because you have very limited research when it comes to this. And there are numbers from this report. Only 1685, that is merely less than 1700 research papers were published by ICMR in the year 2015 and 16. Just think about this. Think about the number of institutions we have. Think about the number of researchers we have, and think about the number of research papers being published, which is very low. And only three patents were granted in these 2 years. So ultimately, if we do not invest in research, we are not going to create something new. We are not going to, say, innovate when it comes to healthcare. Then also, the solution for this, if anyone has happened to go through the national education policy, or maybe in your current affairs, or maybe the policy as it is, you'll find that they talk about a renewed push towards research and development. They talk about your research, specific research based institutions, right? So we will come to that, we will discuss that. But think about how we need to invest more in research and development when it comes to healthcare. We need to invest more in research and development when it comes to our higher educational institutions, because ultimately the people who are getting into these higher educational institutions are going to become researchers in the future. So there has to be research and development, not just from public sector, but also from private sector as well. And then you find that there are problems that are always in the news. So if you want to look at the issues related to research and development, apart from what are apart from the things that are mentioned there, you find that with the recent case from Ashoka University, then you find that if there is something which might have an adverse impact on the image of the government, be it state, be it center, they would try to bring it down. They demoralize people from getting into research and development. At the same time, they say that invest more in research and development. We should inculcate a spirit of research and development in our institutions. The same time, they try to bring down those research, those papers. They get those people terminated from the universities. So ultimately, the environment has to be made more, say, open. people should be free to conduct research. Yes, if you feel that because these researches can actually be these researches can actually be promoted or maybe biased towards or for or against the government, it can happen. So they might be biased towards a particular healthcare practice. So for example, why do we feel that why do you think that allopathy is considered to be the most important, to be the best kind of practice? Why? Because most of the researches are biased to that extent. Most of the researches are conducted in allopathy or in Western medicine, and that is why you do not find any good evidences or reports which actually promote other traditional medicine, not just of India but other countries as well. Because, for example, the Chinese have their different practices, or every society, because we have evolved from being very primitive. So every society has their own way of treating people, because health is something that has been an issue for ages now, and Western medicine has been very recent. It is not very old. So similarly, these researches, etc., can be motivated by various factors, but the best way to go about it is just keep a check. Just keep a check that whatever points or whatever arguments are being made, they should be critically analyzed. And that's why we have peer reviews. That's why ultimately the journal in which it has to be published, they have to review it and they have to give it a go ahead before proceeding with those reports or before proceeding with those papers. It's not that a paper is published and people start working on it right away and people take it as the ultimate truth. It is not that. Because when we're looking at various factors, various issues, you find that different reports say, or different reports show us a different picture. But again, we are not PhD students. We are not going for research in that particular aspect. So what we do is we just look at both the facets. We take up credible reports, credible papers, credible research works, and try to make up our mind. But we remember both the dimensions. Okay, so with this, we have pretty much covered most of the preventive measures, be it sanitation, be it cleanliness, be it vaccination. So we have covered pretty much all the preventive measures, but there can be other measures as well. Because think of your promotive health, which has been there in the news, which has been highlighted by your national health policy, which you find related to Ayush. So if you find something new, you can go on adding it to your notes. Now think of curative measures. Now one idea is that we have various diseases which are to be cured, right? So one is we can try to prevent it from happening, and the other idea is we can cure it after it has happened. So any curative measure related to any kind of communicable and non-communicable disease can be mentioned here. Any kind of measure for that matter. So you have measures. So for example, availability of various medical equipment for cure. Think of availability of your pacemakers for heart-related surgeries, right? So everything will be included here. Now we are not going through all the aspects, all the factual details about those. What we'll do is we'll take up the dimensions which are generally not being covered, which are generally the chances are that most of you would not be aware about these dimensions. So let's think about your non-communicable diseases and communicable diseases first. You have various programs of the government. One idea is when we were talking about burden of non-communicable diseases, we were saying close to 60% of the deaths in India happen because of non-communicable diseases, right? When it comes to communicable disease, think of your recent example from COVID, what all measures the government had taken, and you already find a question on that. Now, when it comes to non-communicable diseases, also more weightage has to be given to various lifestyle choices that we make, whether we intoxicate or not, right? What kind of food habits do we have? Whether our lifestyle is active or sedentary? Do we intake any kind of toxicants like tobacco, alcohol, any kind of drugs? How is the environment, whether it is polluted or not? So even when it comes to your non-communicable diseases, yes, there has to be a push towards curative measures. We have to bring down the cost of equipments. We have to bring down the cost of your healthcare services. We should have better hospitals. We should have better facilities available. We should have more choices, etc. All those aspects can be covered, because we do not have to take up particular diseases here. But again, you'll find that it is mostly based on your various determinants of health. It is again based in preventive measures. So there has to be a mix of preventive and curative measures when it comes to various kind of diseases. So this is the simplest idea related to curative measures that you can understand. Just think of the disease burden, think of the new diseases like your lifestyle diseases, diabetes, etc. coming up. What are the various measures being taken by the government? Now, coming back, at times you find that there can be an organ failure. There's a person who is going through an issue and they need a kidney transplant, for example, or a liver transplant. They would need that organ from somewhere because their own organ has been done or has been deteriorated. It is not able to function properly now. So they will need someone to donate that organ to them. That is basically what organ donation is in very simple terms. Now, organ donation, if you think of organ donation, one is that there is a lot of problem when it comes to awareness in people. People do not even consider blood donation as good. People do not even go for blood donation. If I ask you people here, when was the last time that you had donated blood? When was the last time you had donated blood? So yes. Okay, so if you look at this, only very few of you have actually donated in the recent past. Either someone has donated in 2019-18, someone has never donated, someone says that they themselves are malnourished, right? So everyone has different reasons. And mostly, even if we go for blood donation, it is generally to help someone. It is generally to help a friend. It is generally to help a family member. That is what it is. So if you think of, say, blood donation, one or organ donation in general, you find that there is lack of awareness because it is not just about the physical organs, right? We find that the prevalence of organ donation in India is low. If you compare it with other countries, you have the report here. In India, it is only 0.16% of the people, or 0.16 per million people who donate any organ. So you find that there are various societies who which work in this direction, and they actually take the consent of people that do once you have died or after your death immediately, can we come and take up a few organs? Can are you ready to donate a few organs? And yes, now you find that a few people, an increasing number of people, are actually filling that consent form and they're saying so. But what happens is that if either the people or the society is not informed, they are not being informed by the family members. And what I have seen in person is that someone had agreed, given their consent to donate their organs after their death. The people were informed by one of their siblings. They came down and the family said absolute no, that we are not going to let you touch the body. We're not going to let you take any kind of organs. And what can they do in those cases? So the first idea is that people have a lack of awareness when it comes to organ donation. And this uh, awareness is actually based on the lack of social responsibility. Lack of social responsibility. We do not think of, say, being, we do not think of letting people or say being helpful to people at least after our death, because it would not matter so much. Once a person has died, once a person is dead, how would it matter, right? Even if you donate the organs or not. uh, Okay, so let's look at why we find such a low level of organ donation in India. The first idea is lack of education and awareness. People are not aware. Then mostly this lack of awareness and education is based in lack of social responsibility, that people do not have that say the sense of social responsibility, right? They do not have the sense of community living, that they would not want to help others. Then ultimately there are no facilities. Even if you want to donate, where are the facilities? Because you need a facility to actually make that happen, to make the not transplant, but at least you have to extract the organ. Then you have to keep it safe, you have to take it safely. Where is the infrastructure for all that? There is a lack of infrastructure. Now the problem is not that people are not ready to donate. The problem here is the problem again is that because of this mismatch in demand and supply. Why? Because there are a lot of people who actually need organ donation, or who need organ transplant, but a lot of people are, or not many people, donate their organs. So there is an obvious mismatch in demand and supply. Now what will happen when there is a mismatch in supply? People will try to traffic these organs, right? People will try ulterior means to get hands of this organs. And according to a report, you find that about 2.1 lakh Indians need kidney transplant every year, but only 3 to 4,000 transplants take place. This is one idea about the gap or the mismatch between demand and supply. Then, one fifth of the total kidney transplants that happen all over the globe, you find that one fifth of these transplants are actually being sourced from the black market, being sourced using commercial means, being sourced using unethical means. Now, one idea is that someone has already highlighted that there can be an ethical concern. So I think 2 3 people have highlighted this problem, that there can be an ethical concern related to organ donation. So the first thing is that whether it is the way you approach in ethics, right? So the way you approach in ethics, you think about the consent, whether the consent of the person has been taken or not, etc. But now we are not going to take up that ethical approach here. We're not going to discuss that approach, or the ethicality of it, or the morality in it. What I would just make a simple argument saying that as long as the person has given consent to, as long as the person is dead and they have given consent, it should not be a problem. It should not be a problem. Because ultimately, if you think about ethical concern in organ donation, then what happens to organ trafficking? Is it not uh, is it ethical or not? Organ trafficking obviously would say is not ethical, but this organ trafficking is happening. Why? Because we do not have as many donors. So even if we take the utilitarian approach, so one utilitarian approach says that once the person is dead, they do not need their organs. Why not give it to someone who actually needs it, right? That is one argument based in utilitarianism. And the other argument is that ultimately, even if you look at the overall, say, happiness index for that matter, you find that because of say lack of supply of organs, because of less and less number of people taking up organ donation, there has been an increase in organ trafficking, which is actually unethical. So why not go for organ donation? So there can be various arguments, but the simplest idea here is, once the person is dead, how would it matter, right? No. See, Sneha, you're saying that is it because of religion that people do not donate? Social religious reasons can be one, right? So there can be concerns saying that the body should not be particular. Even if particularly you look at Hindus, they would not let even the bodies go for post-mortem, right? So in many of the cases, you find that the families do not agree for post-mortem. Why? Because according to the culture or the tradition that has been there, you find that the body is not supposed to be say disintegrated. But ultimately, you think of the ethical concerns in organ trafficking rather than organ donation, right? Because organ donation does not have as much say ethical concern as organ trafficking has, and organ trafficking happens directly because of organ donation not happening. Okay, so look at the various challenges. One is the supply and demand gap, then inadequate infrastructure for organ transplantations, etc. Then if someone is brain dead, there is no way to actually identify and certify brain death, because if someone is brain dead, ultimately you can uh, take up organs. Again, it is very utilitarian in a way, but also you think of the social responsibility that a person has. We find it unethical mostly because of the socialization, basically, because we do not take up social responsibility. And if you happen to read say a few articles on ethics, etc., you'll find a lot of these concerns related to social responsibility, social accountability keep coming up, that how people are not ready to become a part or not ready to accept their responsibilities, right? So if you, even if you think of fundamental duties, I think that is the most redundant part of our constitution, at least has been made so, which should have been the most important, because the idea of citizenship talks about rights and duties. The idea of citizenship in general talks about the relationship between rights and duty. If you become a member of this community, if think of state, if you become a member of the state, you'll get certain rights and you'll have reciprocal duties. But duties are something, fundamental duties are something that are mostly ignored. It is considered to be, they're considered to be redundant. If we do not believe or we do not say vouch for fundamental duties or constitutionally say constitutional responsibilities, it is not very simple to think about social responsibility. Okay, then because of this organ donation not happening in good numbers, you find organ trade and trafficking becoming popular or becoming widespread. And you find that it is not just with their consent, because at times people, because of various economic factors, people agree to this. And you'll find a lot of cases where it has become a commercial thing, right? So be it your blood donation, be it related to your kidney, because a person can work on one kidney very well, right? So they would not be able to work as their body would not function absolutely equivalent to two kidneys, but yes, at least with one body they can function fairly well. So there are people who engage in this commercial activity, but yes, there is a problem with making this commercial, because organ donation should actually happen for altruistic reasons. The way we were talking about surrogacy, that this surrogacy regulation bill talks about surrogacy happening for altruistic reason, for actually helping someone, so should organ donation be. It should not be made a commercial activity. Then organ trafficking, uh, and particularly in women and children and people coming from socioeconomic backgrounds, you find various reports which highlight this problem, that children are being trafficked, children are being kidnapped, their organs extracted, and then rendered or then pushed into the organized crime, or pushed into these uh, various groups of beggars, etc. Now, to curb this problem, government has your Transplantation of Human Organs and Tissues Act, wherein they regulate any kind of removal, storage, etc. of organs. They try to keep a check, but again, it has not been very effective. It has not been very effective, for that matter. And again, I was going through a report related to this, but yes, you would not find it being very effective. Because it ultimately comes down to implementation part, and the implementation has not been great, for that matter. So major reasons for organ trafficking, it can be poverty, because people are poor. One, they would agree for this commercial trade of organs. Second, because they are poor, they are unaware. it can happen. And there was a recent movie wherein they say that, okay, we will treat you for your blindness, but the doctors try to take out or remove one of his kidneys, right? So it can happen because of various reasons. It can be because of your collusion of medical institutions, right? So they would suggest that we are doing this, but they would actually do something else. It can be coercive in nature, kidnapping particularly your young children, and removing their organs, etc. So this is something, these are a few challenges that you can actually think of related to organ donation. I don't think there is a need to go through the list for that matter. Transplant tourism is basically, you find that India, being a poor country, has become a premium destination for organ transplants. The reason being because you do not have a lot of regulatory mechanism in place. It is easier to flout norms, and you find that people who are in need of any kind of organ transplant, they prefer India because of easy availability, because people would agree for a mere price. That is what transplant tourism is. Then diseases we have already seen. Then let's come to the compulsory licensing part. Basic compulsory licensing is, think of any product, and let's stick to our pharmaceuticals. Think of any drug which has been created by a particular company. Now what they'll do is, they will get the process patented. By the process, they have created that drug. Now, because it is their patented product, they are the only ones who can sell that product in the market. They are the only ones who can sell this drug in the market. And generally you find, to cover their cost for research and development, the prices of these drugs are very high. Now, a compulsory licensing says the government can actually provide this license to manufacture that medicine, to manufacture that drug without the permission of the patenter, in any kind of emergency, in any kind of national emergency, and also for non-commercial use. So if you look at your generic medicines that are there, if you look at your generic medicines that are there, you'll find that they are actually equivalents of those patented drugs and medicines. But the government had given compulsory license to a particular company to create those drugs. Why? Because they are necessary. If you remember, there was talks of, or there was a lot of lobbying going around during the times of COVID for making this or for providing this compulsory license, for a few drugs. Now, what will happen is, if you provide a compulsory license, you do not have to take the permission of a patenter. The medicines can be, say, manufactured at a very, say, because the manufacturing cost is not huge for that matter, and they can actually sell it for non-commercial use, because they would not extract any kind of profit from that medicine. So which can bring down the cost of your medical treatment or any kind of treatment. Why? If you remember, out of pocket expenditure, we are saying medicines are one of the major portions where your out of pocket expenditure happens. So this compulsory licensing is something that you read with IPR in your science and technology, because it is not limited to pharmaceuticals. There can be other products as well. But still, I have given a little write-up, because ultimately, if you think of reducing your out-of-pocket expenditure, you have another point. You have another point. So we are saying, regulate your say private sector, so that they do not increase the prices or they do not inflate the prices. Then we were saying that provide insurance. And then in the case of medicines, you are saying, why not bring down the prices of medicines? If medicines are the ones who contribute most to out-of-pocket expenditure, why not bring the prices of medicines down? How can you bring the prices of medicines down? You have compulsory licensing. How can you bring the prices of medicines down? Conduct public research, right? If you're people coming from public institutions, and in your public institutions, if you conduct a lot of research, then you'll also be able to patent a lot of products, a lot of medicines, and the government can definitely keep that price down. Give the researcher her due share, and ultimately keep it at a very low cost for the masses. So as long as we do not conduct a lot of research in India, and particularly in our public institutions, we would not be able to bring down the prices of these medicines. Compulsory licensing is one way, but again, it is limited. It is only in the cases of extreme necessity. But we have to think about bringing down the overall prices of medicines. Then it comes to clinical trials. If you remember, and particularly during COVID times, it was there in news a lot. Now, what happens is, for any vaccine, for any drug to be made available to public use, it has to be tested. They conduct a lot of research, they conduct a lot of experiment on that, uh, whether it is effective or not. So initially uh, and previously they started with animals, etc., and ultimately they would have to experiment these drugs, these medicines on people. There have to be human trials. Why? Because before you make it available to, say, millions and millions of people who might get adversely impacted, why not experiment it on a few volunteers, limited number of volunteers, to check whether it has any adverse side effects or not? And if you see that, yes, there is a concern that why should those people bear all the social responsibility? Why should those be the people who get experimented with these drugs? I do find that when it comes to clinical trials, India has again become a premium destination. The first reason, again, we being a poor country. Now, please do not think that because when we say we are a poor country, because we have a huge number of poor people, right? Because we have to stick to the idea that we are going to become superpowers in the future. And yes, the few who have this idea that we are already a superpower, we should actually keep that in mind as well. So when we say poor, we think of the number, or think of the poor in absolute numbers, that because of our huge population, we have a lot of poor people as well. Now, why? Because rather than these clinical trials being voluntary, because if you look at the definition, you'll find that these are experiments which are conducted on human volunteers. Now, volunteers are ones who do not do it for sake of any kind of, say, monetary benefit, who do it out of their own free will. They are not forced to do this. Those are the ones who can be termed as volunteers. But you find that these clinical trials actually happen because of commercial reasons. The people, uh, particularly poor people, particularly vulnerable people, they think that, okay, yes, it can be, say, it can substitute a family income. It can be, say, better for us. It can increase our family income. And people go as volunteers, but ultimately for the sake of any kind of commercial benefit, monetary benefit. Now, because of the poverty, India has become a destination. Also, people are not aware, because the organization would say that it is not going to have any kind of adverse impact on you. This is just for medical research purposes, and they would agree. Why? Because they're not aware. And even in initial stages of clinical trials, you find that people are not aware that, at least in the initial stages, there can be adverse impacts. There can be adverse effects of that medicine, of that drug. And also, the effect of drug is ultimately also of your human physiology, or your, say, the your genetic makeup is also a factor when it comes to the impact of any kind of medicine, right? Those same medicine would not impact everyone equally or in a similar manner. There can be differences. So people are not aware about all this, and they agree to these clinical trials. Then in India, for those companies, it is easy to violate law. We do not have a very rigid regulatory mechanism here in our country. They can go away, or they can actually get away with any kind of problem. Then you think of the racial diversity that our country has. Now, why the idea of racial diversity? Because these medicines or vaccines, once manufactured, they'll be made available to people across the globe. Now, if you think of this on the basis of your race, you'll find that your race actually is coming from genetic factors, right? What are the, say, most prominent genes that you have? That is where your, say, racial identity comes from. So to make it available to everyone, you have to test on people coming from various racial backgrounds. Now, what is better than India when it comes to racial diversity? Because in India, you pretty much find every other race that is available. So you're finding every people from all the races in one place, and that to a place where where you do not have a lot of rules and regulations, where you can easily flout the norms. And also, this process needs to be conducted, because the better the speed, or the less the time that they take in these clinical trials, it is better for the company, because they have to ultimately make it ready to be sold in the market, right? It is a race against time, basically, because they have been investing resources on this and they want it to happen quickly. So to find all the people from different races in one place who will come for a mere amount, they do not have to care a lot about regulations. And then also, because of India's tropical weather, you find that your bacteria, viruses, they will multiply easily in tropical weathers. So because of that, the clinical trial, or the trial, or the experiment actually gets fast tracked, because within a few days those bacteria will start multiplying, and they can actually check the response of the drug, because in colder weathers it will take more time compared to tropical weather. And this is the reason because of which you find that India has become a premium destination for clinical trials. Now you find you have your Central Drugs Standard Control Organization, which basically is the authority which is responsible for conducting clinical trials. They set the standards, they set the rules, they decide what has to be done. But there are still various problems. That one is that the regulations are not very strong, not very rigid. The cost of testing is very low, as already highlighted. These pharmaceutical companies and doctors collude with each other and go for unethical drug testing, because they would not inform the volunteers that what can be the possible adverse side effects of this particular medicine, of this particular experiment on them. They can actually get an irreversible disorder in their body. So these companies, these pharmaceutical companies actually collaborate with these doctors. They say that, yes, we will return this favor. Please convince people to come for this trial. Now, also at times you'll find that this was the issue that was being discussed during COVID, that without conducting all the phases of clinical trial, why the vaccine was made available to the larger public, because there could have been adverse impacts. So there are a lot of companies who will bypass this process of conducting human trials or conducting clinical trials, and ultimately make their product available in the market within no time. And if you see that, we have already discussed that it is because of poverty, because of poor people, and they are ignorant, they do not know anything about the side effects, etc., and they get exploited because of this. Now, this was all about various measures taken by the government. What are the challenges? Wherever we could find challenges, we have highlighted the challenges, like challenges related to privatization, digitization, etc. What are the significance and everything. So these are basically various measures taken by the government as per the recommendations, or as per the suggestions provided in your national health policy. Everything that we have discussed works under the framework of your national health policy. And you find that all these things, or all these measures, had something to do with providing universal health care, with providing universal health coverage, with providing access to quality and affordable health care. All these things have a direct impact on that. So now what they can do is, they can ask a question related to national health policy. They can pick up a particular dimension, that how would this dimension help in taking care of your objectives of national health policy? How can they help in providing universal health coverage? Then also they can ask you about suggestions from various dimensions. They can ask you what can be the suggestions to make your human resources for health better. that we say that they are unavailable. We say that the the patient to doctor ratio or the doctor to population ratio is very low in India. How can it be fixed? There are issues related to quality or issues related to qualification of your doctors. Why don't we have good institutions here? What is the problem related to brain drain, etc.? So they can ask a question from suggestions on these particular dimensions. Now, do you have to say write about all these dimensions? No, all these things have been covered through your various government measures, right? So government already has say already has some plan or the other or some program or the other to achieve these. So think about community participation and citizen engagement. You can think of promotive healthcare. What does that lead to? Citizen participation. Similarly, if you think of access to medicine, vaccines, and technology, think of digitization, National Digital Health Mission. Access to medicine, think of making it available for all, making it affordable. Think of your Jan Aushadhi Kendra. So all these things, suggestions have been discussed previously. What I've done is I've given you the broader dimensions here, and also you can go through this article. It is not a very recent article, but yes, you can just go through this article. They are also talking about 7-8 suggestions, so you might get a good point or might get a good language to write from here. So all these suggestions that are there, all these dimensions that are there, I have mentioned the final suggestions, so that if a question is asked about, say, health financing and financial protection, you have all the answers in one place. Similarly, if something is asked about human resource, you have everything in one place. So I have mentioned these. You just go through these. These are fairly simple. Just go through these during revision. Everything has been discussed if you look at it, and it would not be much of a problem for you. Why it has been done? So that you have all the content in one place. Now, before we go for break, because a lot of people are getting hungry, or maybe they want the tea, or they just don't want to see my face. For all those reasons, we are taking a break. Just do one thing, look at this question. Okay, this is a question we have indirectly discussed, or at least I've highlighted the dimension. Just look at this question. Please do not look at the answer that has been provided in the PPT. Look at this question, think of how to conceptualize the answer, and then after the break, we'll discuss this answer, we'll discuss this question, and then we'll move on towards education. Okay, so let's take a break and India is neither poor nor illiterate, was neither poor nor illiterate, but later we were made so. In ancient times, we had institutions like Nalanda, Takshila, etc. Yes, this is true. There's no disputing this fact, right? We're not disputing this fact in any way. But the idea is, if we go around sticking to the past, we do not see what is happening around us and what can be the way forward. Right. So it should be more about realizing what is the situation now and how can we fix it. That is what the idea is. So yes, we should take say lessons from the past, but it should be limited to that. So, and I forgot the thinker. I forgot the thinker, and who had mentioned that it is mostly because of the our fixation with past that we are not able to do anything either in the present and the future. Okay, so let's discuss this question. Here it says that traditional medicine systems. Now, traditional medicine systems, you can directly think of your Ayush, can help India achieve universal health coverage. We have to discuss this and also highlight the challenges in doing so. The question says traditional medicine systems can help India in achieving universal health coverage. And also, we have to look at the challenges related to this. Okay, just think about this. We are saying that one of the major objective of our national health policy is universal health coverage. What is universal health coverage? Providing access to quality and affordable healthcare. And what we are saying was that if you think of universal health coverage, just think of all the measures, all the government measures that we have looked into. How can they contribute to universal health coverage? Right? Out of these measures, one is traditional medicine, and we have to look at the that how this traditional medicine system or Ayush can actually help us achieve universal health coverage. So we have to think about this. Now, think of other dimensions of this question. The idea is that it is not just traditional medicine system which can help India achieve universal health coverage. There can be, so body will contain traditional medicine system and how it can help us achieve universal health coverage and challenges in doing so. We will come back to the body part. Now think of the other dimension. The other dimension is why just traditional medicine system? There can be other ways to achieve universal health coverage. What idea is that? Now, if you think of your conclusion, because we have mentioned challenges in the body, we can definitely give solution to this. That we will come to once you understand the challenges. Once you understand the challenges, we will think of the solutions. So your body and conclusion is done. Body will think of the points. Now think of introduction. One way to introduce can be One way to introduce can be think of other ways which can help us achieve universal health coverage. Another idea can be think of examples. Think of any examples, any international examples for that matter, or think of examples where traditional medicines or your Ayush has actually fared well. Think of examples in that sense. Then also, your introduction should cover this part. That you just give an idea briefly about the traditional medicine systems that we have in India. So that is basically Ayush. Plus you can think of how government is giving a push to this idea, how government is taking up this initiative of Ayush. So these can be various introductions. Apart from this, just let me look at your answers. What are you suggesting? Introduction, traditional system versus other system, challenges. Okay. So one thing is, please remember that you have to write about Ayush in any of the introductions for that matter. No matter which one you go with, please do write about Ayush. Yes, so Ravi, you are suggesting, right? But that anyways is a part of your body. Baldev, you're saying we can use facts. Just think of any fact and suggest. Think of any fact related to this. Okay, so maybe these 2-3 introductions can be used. 2-3 ways to introduce this answer. Now just think of how it can help India achieve universal health coverage. Now remember this, when you think of traditional medicine systems, now you have your Ayush in mind, one thing. Second thing is you have to think about access, you have to think about quality, and you have to think about affordability. Why? Because these are the 3 components of universal health coverage. Because you would not find, you cannot say that it is, say, accessible and always quality, right? Because again, we have lack of research, and we'll come to that part. But remember, when you try to address this answer, you do not have to write access, affordability, and quality, but you have to break these things up in your mind using these categorization, because ultimately these are the three parts of three components of universal health coverage. Okay, so now suggest the body part. How can traditional medicine system help India achieve UHC, universal health coverage? Please suggest. Yes, so Ravi, Vaishna, you are suggesting recent examples. Good. Okay, so yes, affordability is one aspect, that these are always affordable. You can think of your homemade remedies, right? Because these are something that people are used to. Homemade remedies are something people are used to, because what happens? You're staying away from your family, you get sick for some reason, you have a cold. Before taking a medicine, before taking a pill, you consult with your parents. Is this something homemade? Is there any home remedy that is available to cure this problem? And they definitely come up with something or the other, and which works very well. So they would have very less side effects. Great. So the quality is improved. Great. The access is improved in the sense that they are traditional systems and people have been using it. They're available. People know, people have been passing on that knowledge from generations. Great. So yes, there is no trust deficit. There's no trust deficit between people and these healthcare systems. Also, great. So Vishnu has highlighted that these your traditional medicine systems are mostly preventive. If you remember, it was mentioned there, preventive and promotive. So even though Vishnu has not highlighted this exactly, but the idea is they are preventive and promotive. So ultimately, if they are preventive in nature, you would not need any kind of cure. So if you stick to say Ayurvedic nutrition or Ayurvedic diet, that is being say the idea that is being popularized by Ayurveda, or the idea of sattvic diet, it is preventive in nature. It will keep your health better. So you would not fall sick that frequently. It will increase or enhance your immunity. So yes, they are curative in nature as well. What we are saying is that the more emphasis, when we are talking about healthcare system, we are saying, why not promote and prevent diseases before they happen? Because prevention is, yes, ultimately better than cure. Yes, they can cure diseases as well. There are benefits, and I'm coming to this. I'm just taking your suggestions. But you have to emphasize on this preventive and promotive aspect. Okay, they are available easily at very low cost, etc. Now think of the challenges. Think of the challenges that we might face in achieving universal health coverage through traditional medicine system. Okay, so you are saying that we do not have a lot of scientific backing, and that is absolutely right. As highlighted, that we do not conduct a lot of research in traditional medicine. So we do not have a lot of scientific evidence. And we think that Western medicine, being backed by quote unquote evidences, we deem it better than traditional medicine. Then yes, so your traditional medicine needs a lot of discipline. So the idea has to be self-discipline for that matter, because it will take time. It will test your patience. Now, yes, it has not been popularized. We do not conduct a lot of research in it. The knowledge that has been passed down generations is, you find that if you think about yourself, if you think about our own generation, you'll find we do not know. A lot of this information has not been passed down to us. Why? Because the Western medicine has become very popular. So yes, it takes time. Absolutely, yes. Great, great, great. Okay, so biasness towards Western medicine, having trust deficit when it comes to traditional medicine, etc. Okay, so we will come to the exact structure of the answer. So bitter taste is something that goes hand in hand with any kind of medicine, right? So any medicine, and if you think of your Western medicine, is actually more bitter. compared to the traditional medicine, it is higher on the bitter side. Okay, so yes, you understand this fairly well. The basic idea behind keeping this question was so that you do not keep all the information that has been provided in watertight compartments, that you think of preventive, promotive, etc., curative separately. Also, so that you understand that they can ask a question on one dimension. They can ask a question on a single dimension, so that you are prepared. And this is something that I feel there might be a question related to this year. Let's see what happens. Okay, so coming to the structure, all the points that you have suggested here, okay, I have not mentioned the points. All the points you have suggested here will find a mention here. So so the introduction about how what are the various components, or what are the popularly used traditional medicine in India, and you think of Ayush, you mention Ayush, then you can highlight a few shortcomings of your Western medicine. You can highlight a few shortcomings of your Western medicine, so that you prepare the basic framework for moving towards traditional medicine. Also, you have to remember that it has to be integrative in nature. They're not saying that we should rely solely on traditional medicine system. They're saying that we have to integrate. There has to be an integrative approach when it comes to traditional medicine. So, because rather than relying on one form of medication, it is better to follow more than one system, so that there is more coverage. They are cost effective because most of the remedies can be taken care at home. If it is not something complicated, most of the things can be taken care at home. It is preventive and promotive in nature. It promotes the idea of self-care. What is that? People actually using the traditional knowledge, the understanding, for their own betterment. So it is making people a part of the process, rather than going to a doctor, rather than visiting a doctor and asking the doctor what has to be done. It is better we take care of our own selves. So yes, it has a promotive and preventive aspect related to it. Then you can actually use international examples. For example, the example of China has been mentioned here. They have integrated it in their mainstream health system. And you look at China, they are faring well when it comes to all the indicators. When it comes to various indicators of health like IMR, MMR, etc., they are faring well compared to us. So you can use a few examples to substantiate anywhere. So I've given 2-3 examples here: the example of Switzerland, the example of African nations, the example of China, which can be used. Then you think of challenges. Now, from your challenge, I have created another question that we will come to. From your challenges, you find that people have diverse preferences. It is not just preferences, it is about needs as well. People coming from different age groups, they will require different kind of treatment. People coming from various genders, they will need their specific thing. Then you think of preferences of people in terms of say something that is time consuming or something that is quick. So if you are a student, you're studying, you have your examinations coming next week, and you think of going for a homeopathic treatment of something, of an ailment, there is no possibility. Why? Because you have to be up and working within next 5 to 6 days. So you will end up relying on allopathic medicine, Western medicine, because it is faster. So everyone has different preferences, different needs for that matter. So just keep thinking about what can be these diversity in preferences of people, because we have another question based on this diversity of preferences. Okay, so just keep thinking about this. Now, the traditional knowledge has been gradually eroded. So when I was saying that, if you think about our generation, we do not know a lot about traditional medicine, right? So if you think about your parents, if you think about your grandparents, they had lot more knowledge compared to us. Why? Because it has not been passed down. Why? Because the Western medicine has been spreading. The Western medicine has been getting popular over the years, because of which we do not think about traditional medicine. It is considered primitive, right? Because it takes its own sweet time. Then you think of the investment that we do in the research. So the investment in overall research in healthcare is less than 1% of our healthcare budget. And if you think about traditional medicine, it is even less. Out of that 1%, actually less than 1% of that 1% goes into traditional medicine, goes into research in traditional medicine. So if we do not conduct enough research, we will not find enough evidences, we do not find enough scientific backing, and people will remain with that mindset that this traditional medicine is not very effective. People would not go for that. So we consider it to be unscientific and lacking evidence, but it is just consideration. Why? Because as long as we do not have we do not say conduct enough research, we cannot say that with conviction. And if you, when you want to conclude it, you can just think of addressing these challenges. You can think of how you can integrate Western and traditional medicine system, because it is not about replacing the Western medicine, because there is a lot that Western medicine can do that our traditional medicine cannot, right? So there are shortcomings when it comes to our traditional medicine, so we need Western medicine to cover those things. So your answer or your solution should reflect uh, an integration between Western and your traditional medicine systems. So integrative approach, that there should be, that how can you do that? That there should be a dialogue between uh, your healthcare practitioners of traditional medicine and Western medicine. Because generally what you find is that the Western medicine practitioners go on talking negatively about the traditional medicine. If you go to a traditional medicine practitioner, they'll go on talking negatively about your Western medicine. But the first question they'll ask is, okay, so you been to a hospital for this ailment? And you'll say yes. And they say, okay, how long did it take? How long have you been taking that prescription for? You say a week or two, and they'll say that you go on taking that prescription for another year or two, and it would not help. So generally, that is the kind of thing that you find, that people are not accommodative of each other's ideas. So to increase that dialogue, now this dialogue should not be increased only at the practitioner level. You think of the level of college or higher education institutions. And the idea of creating multidisciplinary universities in your national education policy will actually promote this as well, that people coming from diverse backgrounds can actually discuss their ideas, can conduct research, etc. Okay, so this is the answer to this question. You can go through this because this is pretty much the entire answer. This will cover your word limit as well, but before you check the answer here, try to write it in your own words. And also, it is just, do not keep your understanding limited to traditional medicine system. Just think about other factors. So as I was saying, that how can we achieve universal health coverage by investing more in public infrastructure? How can we achieve universal health coverage by privatizing healthcare? So it can be related to any dimension. So you should be ready with your answer, that what is the way, how can we do that, and what are the challenges, what are the shortcomings. Okay, moving to the next question. Now, I've not provided the answer for this question. This is something that we'll discuss and you would have to write on your own. So the diverse healthcare preferences in India are governed by a complex combination of factors at the individual, socio-cultural, and health system levels. Diverse healthcare preferences in India are governed of factors at the individual, socio-cultural, and health system levels. And we have to discuss this. So you can write this in 150 words. That'll be sufficient. Okay. Now think about this. What are these diverse healthcare preferences? So one idea is that these healthcare preferences can be diverse because of various reasons. And also, we have given the broader highlights: individual, socio-cultural, and health system level. Right, so we have given three broad dimensions. Now think of the diverse healthcare preferences in all these dimensions, in all these factors. Okay, starting with individual level. On the individual level, what can shape your preferences when it comes to healthcare system? Great. Your income, your levels of education and awareness, great. How about your upbringing? Right. So yes, your family. Now, family becomes a socio-cultural factor, but it can be covered under individual as well. Then you think of your gender, age, because we see that the elderly need different kind of care. The we need to say think about specific needs of women. We're talking about iron, etc. Right? If you remember. Then if you think about socio-cultural, think of think of the region you are coming from, whether you are coming from rural area or urban area. If you are from urban area, the chances are you would prefer any kind of private hospital in urban areas. If you are coming from rural areas, then you would not have any option rather than going to your public healthcare system. But also, if you're coming from rural areas or if you are coming from a traditional setup, you'll find your inclination more towards traditional medicine system, right? So yes, your religious beliefs, because of your religious beliefs, you might avoid Western medicine at all costs, right? So there can be various socio-cultural reasons which shape these preferences. Then you think of health system level preferences. Sorry. You think of health system level preferences. Yes, so your lifestyle, how sedentary your lifestyle is, what kind of nutrition you take, etc. They also shape your preferences. Now, when it comes to health system level, just think of it, because we have just finished covering it. That your health on the health system level, again, affordability can be an issue. The availability or access to these healthcare facilities can be an issue, right? Great. So, what kind of quality of healthcare you are getting can be another thing. Can superstition be in socio-cultural? Absolutely, yes. The superstition would fall under socio-cultural for that matter. Now, again, there is no watertight compartment, because your individual preferences are ultimately shaped by the society, are ultimately shaped by your health system. Because you might, if you remember the idea of socialization for that matter, right? Okay, so this was just to give you a glimpse that whatever you have read previously can all be integrated in one question as well. So a question can be framed from one dimension, looking at its impact on universal health coverage. Then a question can actually cover all those finer aspects that we have discussed previously. So I've just given you a brief idea about this. This is more inclined towards traditional medicine, but you have been thinking in the right direction. Okay, now think of your introduction and conclusion. Your body part is done. Think of introduction and conclusion. Think of introduction. So yes, Ravi, you are right when you say that the evidences that are available for a particular health system also shapes our preferences. Think of introduction. Yes, so great. What are the various forms of healthcare system that are available? So one form can be, think of the choices that are available, basically the choices of healthcare system that are available. So yes, diverse healthcare, yeah, that's what I'm talking about. So think of your traditional medicine system, think of your Western medicine system, think of what is available. Then another idea is, as in the body part, we're seeing that all these factors are related, because they're talking about a combination of these factors. what we did was we looked at these factors separately. We have to think in terms of combination of these factors, right? Your individual choices can be shaped by the problems related to healthcare system. So yes, the idea of integrating or combining these factors that they have asked in the question. Yes, affordability is definitely a factor. Affordability has been actually mentioned in two places. Affordability can be a factor. Okay, so we are talking about other factors that can influence your preference. There can be other factors. For example, the role of media, the role of advertisements, etc. Okay, so XY is suggesting that we can think of why this interrelation exists, can be written in introduction. Yes, absolutely. Okay, so there can be various forms of introductions, and in conclusion, you can think about how government is actually taking all these factors in account. Let's end this on a positive note, thinking about how government is taking account or keeping an account of all these factors while actually working towards bettering our healthcare system. So if you see now, to achieve access, affordability, and quality, they are using privatization, they're using traditional medicine system, they're using digitization, right? So all those things can be mentioned in the conclusion part. So I hope this question is clear. I hope this question is clear. And from this write-up, you can find actually significance. Rashmi, the way you are discussing the significance of factors can be found from this write-up. Okay, now think about this question. Now, this is a question to which you would not have the exact answer, but let's look at this question and just think about it. A policy is only as good as its implementation. In the light of this, critically analyze the national health policy. Critically analyze the national health policy. So one idea is, they are saying a policy is as good as its implementation. So giving due importance to implementation. So your body part will actually be covering implementation of your national health policy. And if we have to critically analyze, we have to see where it is working better, what are the shortcomings, right? So we have to look at both these dimensions in the body part. Now, apart from this, if I say, the moment I say that policy is only as good as its implementation, is this statement true? Is this statement true? Yes, we see that implementation is one of the most important part. But what if there is a flaw in design? What if the targeted group that you have decided is wrong? So you are saying yes, absolutely, it can lead to failure. Failure of implementation will ultimately lead to failure of the policy. But can there be other problems? Can there be problems at the design level? Yes. So you can think of wrong data set used. You can think of the sample survey data that is being used. Maybe you have identified the people wrong. The objectives that were supposed to be there are not there at all. So there can be problem related to design as well. So in the introduction, maybe we can write about how apart from implementation, design and evaluation of the policy are also important. Now you'll understand the finer aspects of design and evaluation and implementation in the last chapter, that is your module 13, in our last discussion, we will cover this part so that you get a clear picture. For now, the thing is, if you talk about implementation of your national health policy, you'd have to think of various programs that are part of this policy. Your various programs related to cleanliness, sanitation, vaccination programs, etc. Your Ayushman Bharat. Then you think about your vaccination program of Indradhanush, etc. So you have all these programs have to be looked into. But do you think you'll have sufficient content for all those programs to critically analyze all those programs? And the answer is again no, because you would not find the critical analysis of each and every program in the news or in your newspaper. And how do you do it yourself? Because if you look at the evaluation of the government, yes, one way is that the government will also publish the evaluation of these programs, but you find that they'll be more biased towards the positive side. And if you want to critically analyze, you have to strike the finer balance, right? So you would not have a definite answer to this. There'll be a few programs of the government which you might find mentioned in the news and you might remember. But otherwise, you would have to use a basic framework of how to critically analyze these policies and programs on the basis of their design, on the basis of their implementation, on the basis of their evaluation, so that you can answer this question. Now, you do not have that framework right now. That will be covered later. But let's think about what can be written. What can be written? Okay, so can we add challenges to the policy? Absolutely. This is basically talking about the challenges, but it has to be more biased towards implementation. We cannot say dispute the design and evaluation. So absolutely yes. So Ravi is saying that but if you remember our first discussion, on health, we were saying that we talk about achieving access to quality and affordable healthcare. But we then thought of the iron triangle, and we were saying that if we change one of the factors, at least one of the other factor will get affected. So if we target access, then we would have to compromise on quality, the iron triangle. So you can think about how the policy objectives, because it is coming from the objective part, how from the design part, how the policy objectives are unrealistic, are they sound very impractical, because the practical reality is different, right? But that is more related to design. But I'm say I'm happy that you were able to highlight this. Okay, so when you think of implementation of your national health policy, now think of various programs. If you think of your Swachh Bharat Abhiyan, has it been perfectly say successful? Has your Swachh Bharat Abhiyan been perfect in all aspects, in all implementation? Is every city clean? Absolutely no. So you can think of a critical analysis of that program. Similarly, if you think of your Ayushman health and wellness centers, I have already given you an idea that not every state is using it, is actually achieving those targets. Then again, if you think about digitization, Payal has been writing this or has been mentioning this, that if you think of various digital programs, digital health mission, there can be problem related to data privacy. There can be problem related to availability of digital infrastructure. There can be a problem related to digital divide. So all those programs can actually be covered here. So this is a good question for you to consolidate all that you know, to consolidate all the programs of the government. Now, yes, absolutely, you do not have to remember all the programs, etc. You do not know the critical analysis part of everything, but at least it'll be a good exercise to storm your brain and bring about all the programs together. Then you can definitely think of the critical analysis. And also, I'll help you with the basic framework of the design, implementation, and the evaluation of a policy in your last chapter, in your last discussion. Then in suggestion or in conclusion, you can just try to fix the negatives of this national health policy. That whatever problems in implementation that are there, how can we fix those problems? And your job is done. So this is a practice question. You try practicing it now, because later you will get the definite answer to this after our last discussion. So in health, what we did was we looked at various problems, various issues associated with healthcare sector in our India, in our country. Then we jumped into our national health policy, that what are the objectives of national health policy, what are various measures that the national health policy has suggested. Then we started looking into those measures, that how they can help us achieve the objectives of national health policy. So all those measures like preventive measures, curative measures, then health management related measures, etc. And then we finally looked at the uh, how one factor can impact universal health coverage or objectives of national health policy. Then we looked into a couple of questions which will where you need the overall understanding of these factors, wherein you have to get rid of these watertight compartments. So you would have to integrate all that you know about healthcare system. So conclusion already suggested, Rashmi. Conclusion, you have highlighted negatives of the implementation of national health policy, that you are saying that there are various challenges related to implementation of national health policy, right? Just fix those. Give suggestions to fix these problems in conclusion. And your job is done. Okay. Now moving on to education and human resources. So what we did was, when we were looking at human resources with health, we covered them there. Human resources for education, will cover them here. Apart from that, we will cover skill development as part of your human resources. Okay. So that will do towards the end of the discussion. And skill development is something that most of us are aware how it goes. So I have provided pretty much everything there, and we'll have a brief discussion after we finish education. Now, in education, what we have to do is, first thing is, we have our National Education Policy 2020. This education policy will highlight various issues related to education and will provide suggestions and the basic policy framework, how we have to actually fix these issues. They'll be found, everything will be found in National Education Policy. Is it not coming on the board? I can see it perfectly well. Can you see the writing? Can everyone see the writing? Yes. Okay, so it might be an issue with you. So you can just refresh the page once. Okay, so what we are going to do is, again, the overall policy framework will be provided by National Education Policy, which will highlight the issues that we'll look into. And this policy itself will talk about how we can go about achieving the objectives of National Education Policy. This is similar. This is in the similar manner as we have proceeded in National Health Policy. But apart from this, what you have to do is, the National Education Policy will consider your school education and higher education separately. That is what we are going to do. Apart from this, you'll find that when it comes to issues related to health, issues related to school education, you have your ACER report, annual status of education report, that comes out pretty much every year. That is being conducted. This is a survey being conducted by your NGO called Pratham. So you have this report for issues related to school education. Then in higher education, you have All India Survey on Higher Education. So we are also going to use these reports. We're also going to use these reports to highlight various issues related to education. So we'll take up school education first, and then we'll move on to higher education. What I've done is, we have kept all the issues in one place, and then all these suggestions in one place, because I don't think it'll be much of a task for you. It'll be much of a task for you to remember those issues. Well, most of the issues we are already aware, and by now you would have developed an understanding that if there is an issue, what can be the possible solution. Now, before we move on to our racer report and everything, okay, this is the question that we have discussed. Sorry, I got confused. This is the question related to nutrition and how we can look at the integration between sustainable development goals and nutrition. This is the question that we have already discussed. Now, before we start with our school education and then move on to higher education, let's just think about what are the problems that are there related to our education system. And I'm sure that you will get 90% of those issues that have been highlighted by these policies. So it is an indication that you are smarter than maybe that pool of all those researchers, right? Your policymakers, you're smarter than them because it took them years altogether to actually reach that conclusion. That is something that you are already aware. Okay, let's start with this. So in issues related to infrastructure, that we do not have adequate infrastructure. We're talking about privatization and associated issues. Great. Our education is not skill based. Great. It is more theoretical in nature. High rates of dropouts. Amazing. The quality of education and particularly the quality of curriculum and our teachers can be questioned. So yes, practical application of your theoretical knowledge is not there. Then Shivam is saying that there is disparity when it comes to education in female. And Shivam, just remember that we are going to dispute this as well. We're going to dispute this using facts. Okay, lack of modern technology in education, less focus on mother tongue. So issues related to language and curriculum. Great. Do you think our curriculum is flexible? Once you choose a particular subject, particular stream after 10th standard, you have to stick to it. So lack of flexibility. How about yes, so poor learning outcomes. I think Vaishna has already gone through the ASA report. Great. Issues related to digitization of education, etc. Fee is high. Then we do not have technical education available in English, etc., etc., etc. Great. Vishnu is being sarcastic when she says that we do not have proper teaching skills. Okay, then great. So the issues that you have highlighted, we will find the mention there in our various reports, etc. Now, before we come to that, I would just want to highlight one thing so that it just changes your orientation of looking towards education. Now, when you before you entered education system, maybe as a kid you might not be aware of the idea, but once you had entered the education system, what has been your motivation for studying and performing in the examinations every year? What has been your motivation for studying in general? Why do you study? The first question is, why do you study? For job, for better career opportunities, for getting better employment, to earn more, for gaining knowledge, for having a better status in the society. Ambesh is saying that she is studying for making parents happy. So, okay, it's not voluntary at all. Great. Okay, so Abhishek wants it for a better match for the wedding. Great. Okay, so everyone has a different idea, but there is one thing, there is something that is in common. There is something that is in common with all these ideas. That basically motivation to study, the motivation to study has been to achieve an end, has been for a particular utility. So my first question is, because I just want to give it an ethical touch so that you understand the importance of education, and this will actually be a good start to understand your national education policy and your various issues. Now think about this. We are considering education as a means to an end. The end being better career, the end being better job, the end being better income, better status in society, etc. Education being a means to an end, which it is. So education has a utility. But my question is, what if we remove that utility. What if we say that if you want education, or you do not need education for a good job? If we remove that final objective that you are achieving through this means, would you still study? If we say that you would not get a good job, would you still want to study? Okay, so only 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 a few say yes, we would still want to study, right? So their motivation might be more towards learning, might be more towards education as something that is significant, that is not just a mere means to some end. Yes. So a few of you are saying that yes, we will still study. Why? Because we want to know, we want to learn new things, we want to know what is right, what is wrong, we want to be aware about things, even if this education does not lead to the objectives that we have highlighted. And what I say is that if you start looking at education not as a means to an end, but an end in itself, you will get your answers. You will understand the entire policy framework. Look at education as an end in itself. Education as an end in itself, not just a utilitarian idea to achieve another end. Education as an end in itself, because this will fix various issues. You are talking about the responsibility that is being taken up by teachers, that the teachers are not teaching properly, they are absent, they're not giving importance to learning, they are merely into cramming facts, etc. They are making us cram facts, etc. Now if they had been educated in a way where it was not just to become a teacher, it was not just to earn more money, they would take up that responsibility. they'll their conduct will be more ethical in nature. Similarly, if a student is more oriented towards learning, if they want to learn, if they want to develop those critical and analytical skills, they would actually enjoy the process of learning. They would not just think about getting good marks in the examination and be out there getting a good job, live a better lifestyle, because that should be just a product of it, because that will ultimately be a consequence. If you study well, if you learn properly, if you have those skills, ultimately you will get something better. You will definitely get a good career option, right? It might take time because market has its own norms. Market does not simply believe in quality, because we think that if you do something, if you say get a PhD and you do everything say perfectly well, that you will get a good job or high paying job, which is not important, which is not necessary, right? So market has its own way of evaluating or valuing people and valuing skills. But ultimately, with good quality education, you can actually achieve all those objectives as byproducts. Those ideas need not be central to your idea of education. So rather than looking at education as a utilitarian idea, which it is, because ultimately education will help you get a better job, will help you with a better lifestyle, will help poor get out of the vicious poverty cycle, will help people to take care of their health better. So it will help, it will have utility, but it should not be considered as a mere utility. So with this idea, with this idea, let's start with various issues related to education. We have already looked at this question. The other question is that right of children to free and compulsory education remains inadequate in promoting incentive based system for children's education without generating awareness about importance of schooling. So this question is also based in this idea that people are not aware what is the significance of education, right? That is the reason you find that students will ultimately drop out, because the families would send them to earn some income because they do not understand the importance of it. Okay, we will come to this question towards the end. Now let's start looking at the issues. Let's start looking at various issues. So when you talk of school education, the first way in which we will highlight a few issues is your ACER report. This is a household survey. So just think about this, This is a household survey. They're not merely going to the school and talking to students. They're going house by house. They're going to every household and checking. Around 616 rural districts and covers 6.9 lakh children between the age group of 3 to 16 years to record their schooling status and assess their basic reading and arithmetic skills. Okay, we'll come to that. Now, if you want to say critically look at it, you can say that it is primarily rural because they are going to the rural districts. They're not covering students in urban areas. So it does not give a complete picture for that matter. But if you look at the scale of this, even though it is limited to rural areas, but if you look at the scale of this, covers close to 7 lakh children, which is huge, right? So the sample size is huge for that matter. And it basically looks into the levels of enrollment in schools, the attendance of both students and teachers. Then it looks at dropouts. Then it looks at dropouts as well. How many children are there who are dropping out of school and at what stage? And what can be the reasons for these dropouts? And it also talks about learning outcomes, which is going to be important. Because this is again one of the objectives in your national education policy. And it also looks into various basic facilities, because the first idea was that we do not have basic infrastructure. We do not have clean drinking water. We do not have proper sanitation facilities. We do not have labs to conduct experiments, etc. So it looks into all these aspects. What I've done is, from this ACER report, I've taken a few graphs which are important for you to understand, and we will think of what are the various observations coming from here. You do not have to remember the numbers. Do not worry about the numbers, but there are a few observations which are exceptions, which are important, which I have highlighted, and I will highlight for you, which you need to remember. Now look at this. If you look at the rate of enrollment, now this yellow part in these graphs are actually of the students who are not in school, who have not enrolled. And if you look at this, it has been decreasing over the years. You look at this 2010 and look at 25 point, or look at 22, you find that the number of students who are enrolling in schools has been increasing. But one thing is that the number of children who are enrolling in schools is increasing for government schools. So if you look at this, if you look at government schools, 71% of the students were getting enrolled in government schools. Now it is 72. There has been a dip in other two surveys, but you find most of the students in rural areas are actually enrolling in government schools. Apart from this, if you look at the basic infrastructure, you'll find that there has been an increase, there has been a betterment in these years, that the infrastructure is getting better. But you look at availability of computer labs, and they have also mentioned the labs which are used by children, because in a lot of government schools you'll find that those labs are merely there. They are ornamental. They're never used. They do not let the students use. So yes, there has been an increase, or there has been a betterment when it comes to basic facilities in schools. These basic facilities cover your drinking water, usable toilets, library, books, midday meal, and your computer labs, etc. So there has been a betterment in terms of infrastructure. But we find that one of the crucial things, that is availability of library and books in school, is missing. But yes, midday meal is being served in the school, and this is one of the most important reason for increasing the enrollment ratio as well. As highlighted by various reports, that because of midday meal scheme, because children are provided with food there. If you remember, in poorer households, we are saying that the children have to take up work. The children have to contribute to family income. And if not to family income, at least they should be able to take care of their own needs. So if they are provided food for free in schools, the families send them to school. Why? Because at least at least two of their meals in a day will be covered there. They'll get nutritious food, because the family has no guarantee whether they'll be able to get them food or not. So with respect to basic facilities, they have you find an improvement. But now let's come to the most important part, which is learning outcome. Now when you think about any policy, or you just take the example of health policy for that matter. In our health policy, we were saying that the objective is your universal health coverage. Okay, just think about this so that you come to learning outcome. Your objective is universal health coverage is the objective which we have to achieve. To achieve this objective, one of the input was what? Your say increase in public expenditure. Increase in public expenditure, that the government spends more on healthcare facilities. That was one of the input. With this input, you find that they can now open more wellness centers, Ayushman Bharat centers, which is what? Which will be basically the output. The output from this wellness center will be affordable, accessible, and quality healthcare, which is your basic objective. And we generally understand or limit our understanding till here. Now come a step further. Come to the idea of outcome. What is the idea of outcome? Now, the outcome that we are looking at is not just opening up of Ayushman Bharat centers, Ayushman wellness centers. The outcome should be that people are actually getting those services and are able to improve their health and well-being. The outcome will here be well-being. Similarly, when you think of education, one idea is that students are going to school. You check whether students are attending school or not, whether they are dropping out of school or not. That is one idea. Then the outcome can be whether you might be sitting in the class, right? You have been sitting here for past 3.5 hours. What can be the outcome? If you think of outcome, the outcome is whatever has been taught in the class, have you been able to absorb it? Have you been able to learn something from it? Because attending school or attending this class cannot necessarily lead to better learning outcome. That is what the idea of outcome is. So when you think of enrollment rates, they are improving. Great. If you think of attendance in school, that is also improving. The dropout rates are going down, as I'll highlight in the observations ahead. But what about learning outcomes? Are students actually able to learn? Are they learning something from there? But when you come to your learning outcomes, your basic idea is you won't be able to understand this grade level. That is what, if you are in third standard, that is where they check in third standard whether you are able to answer questions that are based on your second grade. Because if you come to third standard, the basic assumption is that you have learned everything that was there in second grade. Out of all the other learnings, they primarily focus on the ability to read and ability to do subtraction. Ability to do subtraction in third standard. Looking at these outcomes, you find that you'll find that they are in the range of 20, 25, 26. So that means if 100 students are sitting in the class, only 25% of the students are able to absorb something out of it. Another idea is over the years, particularly, you find that over the years it has been increasing. You see 21 to 23 to 25 to 27. Similarly, 26, and there was a dip in 1 year, then 27, 28. But now you had COVID-related lockdown, etc. for 2-3 years. Post this, you find that there has been a dip in learning outcomes. So previously in 2018, it was 27% students who were able to read at grade 2 level. But now it is merely 20% students who are able to read at grade 2 level. Similarly, if you talk about basic subtraction ability, 28 to 25, that means there has been a dip in learning outcomes. And you'll be surprised that you see that the levels of enrollment have increased. If you look at this, so one idea is that the number of students enrolling in government school has increased. If you look at this, the students who were not enrolled was this much, and now it is this much. So yes, people have enrolled in schools, or students have enrolled in schools, but still the learning outcomes are going down. Now it can be related to various factors. Can you possibly think of factors? So one factor is COVID. Because of COVID, students were not able to go to school. Because of COVID, parents were not able to pay the fee of the students. Students were not used to digital means. Teachers were not used to digital means, etc. This is something you can understand. Apart from this, can there be other factors which are leading to these poor outcomes, poor learning outcomes? And particularly, you have to think about dip, because there can be various factors which are static, like teaching skills, etc. Think about the dip that has happened. No, you do not have to make graphs in the answers. See, Vaishnav, Ambesh, Bharti, you are actually suggesting these static ideas, that why the learning outcomes are poor, that we will discuss. Now you think of the dip which has happened in these learning outcomes. Because one thing is, that you see is that more number of students have enrolled in government schools. Can it be related to problems in your government or public schools? Just think about this. That's why I was comparing this. There has been a dip in learning outcomes from 2018 to 2022, and from 2018 to 22 you find more number of students have enrolled in government schools. Can't it be something related to public schools? So yes, it can be attributed to various factors, even though they have not highlighted the factors. But to think about this, because of COVID, students were not able to go to school. Now what happens is, when it comes to offline way of teaching, there is a sense of discipline in the students. There is a sense of discipline, that they know that they have to sit, they have to behave, they have to listen to the teacher. Because right now, I know there are a lot, there can be say few out of you who are actually looking at something else on their cell phones, who might be looking out of the window, might be engaged in something else. So the idea of studying in the institutional facilities is that it imposes a discipline, or it actually inculcates the sense of discipline in students. Then second thing is, now because of COVID, the studies were moved to online or e-learning. This highlights the gaps that are there in e-learning, because students were not able to adapt to e-learning methodology. The teachers were not able to adapt to e-learning methodology. That is the reason. Also, a lot of parents were not able to send their children to private schools, where it is generally considered that private schools provide a better quality. When it comes to education, private schools are considered to be providing better quality of education. And we find that many students have now enrolled in government schools in rural areas. That can be another reason for these poor learning outcomes. Because all the other reasons that you have mentioned, yes, they're right, but they are not the reason behind this dip. That is what we are saying. Yes, Amish, I said apart from COVID, that the dip in government schools, because I was highlighting this, that's why I was saying. So yes, all the issues related to COVID are basically, you can see that they can be the reasons for these poor learning outcomes. And also we are going to cover digitization of education separately, because that is something is important from education point of view, because our national education policy talks about the role of technology in education. And you see that with increasing say number of e-learning platforms, etc., there has been a few associated challenges with digitization, which will cover. Okay, so this is the number of children who have enrolled in government schools. Now let's look at few other observations from your ACES survey report, or your annual survey report of education. Now, this is important, that I have already highlighted, that basic literacy levels of children have taken a big hit. It was increasing for the previous years, but now it has taken a hit. They are going down. Then you find another important thing is, someone, I forgot the name, someone had highlighted that uh, there is gender disparity. Right? There is gender disparity. But if you look at it, if you look at the report, they find that there is no difference in levels of learning in children by their gender. Right? So that means the uh, equal number of girl girls are also enrolling in schools. You don't have to remember all the observations, and once you go through them once, if you go through them once, you will remember these. You will remember these once you go through it, because these will be helpful for you to actually reach to the issues. Because poor learning outcomes is an issue, and your policy talks about fixing this issue. Your national education policy talks about fixing this issue. Similarly, yes, there has been an improvement in basic infrastructure, but you find that the your basic infrastructure is not as good. You do not have sufficient libraries and books in schools. Again, when it comes to cleanliness and sanitation, basic cleanliness and sanitation related facilities, you find a lot of schools, 20%, 30% of schools lagging behind. They do not have those facilities. So these will help you highlight these issues, and then your national education policy will talk about the suggestions. So there has been a rise in enrollments across all states and all age groups. And we can see with the general graph that there has been a rise in enrollment. So the enrollment in schools is not going to be much of an issue, because a lot of students are now enrolling in schools. And that is why, if you look at your national education policy, the objective or the goal for achieving 100% gross enrollment ratio has been kept for 2030, I believe. Why? Because we see that this can be easily achieved in a few years. Now, government schools have seen a sharp increase in children enrollment. Now, this the reason can be think about this. The reason can be because of COVID, economic condition of the family, etc. Another reason can be uh, maybe the government schools are getting better. Government schools are providing better quality. Yes, the third reason can be because of availability of midday meal. Right, so there can be various reasons, but also you find that if we think about the idea of falling incomes of parents, and parents sending their wards or sending their children to government schools, at the same time you'll find that there has been an increase in the proportion of children who attend tuition classes. So if it is only a factor of, if it were only a factor of money, then people would not have been sending them to tuition classes. Now, these increase towards tuition classes is because of poor learning outcomes, because students are not were not faring well because of say shift towards these digital means. Then you find variations in attendance across states. Then you also find variations when it comes to your gender. There is a slight variation when it comes to gender. Then you can think of dropout rates are still high. There has been an increase in teacher attendance. Why? Because of the your attendance policy of the government. Then children's attendance has remained relatively unchanged. It is pretty much the same. It has not improved for that matter, because we think that all these dimensions will be improving in the years, but it is not always so. School facilities also show steady improvement, as you have looked in the graph. These are basic observations from your ACER report. Now, what we'll do is, we will just okay, tomorrow we'll do that. We will think about national education policy. Just give it a read if you can. Just take up any article which talks about various provisions of national education policy. You can go to PIB and search it. You can just search it on internet, write PIB in front of national education policy, you'll get everything in one place. What we'll do is, tomorrow we will talk about the issues highlighted by your national education policy and what are the solutions, what can be the suggestions for the same. Anushka is saying that dropout rate in girls is high because of lack of availability of toilets. Yes, dropout rate in girls is high. Also high because of because they have to help their mother. They have to help their family with household work. The dropout rates in boys is generally high because they have to drop the school and they have to take up any form of employment, any form of paid labor. That is the reason in them, and we will cover those. Do not worry about this. We will cover those with issues. Okay, so with this, we conclude the discussion here. Tomorrow, we will discuss school education, move on to higher education, and talk about skill development. And then day after, we'll have a discussion on civil society, NGOs, your cooperative societies, and your self-help groups. And on the last day, we will discuss primarily the issues related to design and implementation of various policies, and we'll try to look into various questions related to the same. So, okay, thank you everyone, and good night.